Formally open the meeting. You're all welcome. Just reminding members again about mobile phones and devices. Please switch them off as they will interfere with the recording equipment. I've had no apologies. No other apologies received. Okay. Item 2 is chairperson's business. A number of items I just want to raise. First of all, I just want to acknowledge the role of the former chairperson of the committee, Sue Ramsey, has obviously stood down from her position in the Assembly, and I do think, members, it would be appropriate to thank Sue for her very active participation in this particular committee. So if I could seek members' agreement to do that. Thank you.
I think, Chair, we would wish her well in relation to her health. And I would also reward her fairness as a chairperson. I think she dealt with the business in a fair and open manner, and hope that continues on to the present chairmanship.
Thank you for that. Okay, also under Chair's business, we have a number of new members, so I just want to welcome Rosalie McCorley, Michael McGimpsey and Mr George Robinson to your first meeting of the committee. I look forward to working with you in my capacity as Chair. There is a list of interests on the tables for people's information as well. Just want also to raise the issue of the ministerial statement that was made yesterday in the Assembly on obviously what was two very important issues. Firstly, if I may just reflect on the statement around the budget, the 80 million, the 60 million and the 20 million from the previous monitoring round. However, the detail was not apparent in the statement yesterday, I suppose, how this will be spent. I think we can all be very welcoming of the fact that the money is there, and that certainly the pressures on health are very apparent. That money is there, but there was no detail provided on how it will be spent, in terms of the department's priorities, and there was no detail on what services would either be reduced or enhanced. So I'm suggesting, members, that we would write to the department to ask a number of questions. First of all, and I asked this question yesterday in the Assembly, have DFP set any conditions in terms of how the department spend this money in relation to both the 20 million and the 60 million? Or is there free rein from the department in terms of spending that money on priorities? I think we should seek a clarification on that. And secondly, when will the department be in a position to provide the committee with that detailed paper on how the 80 million will be spent, as well as a detailed paper on which current services will be reduced or ceased and which new services will now be taken forward? So if members are in agreement that we would do that, I'm suggesting that we would schedule an oral briefing with the department on these issues early November. Given our work around the budget going forward as well.
I think, Chair, I think we would support that. I think it's important that we do identify the priorities. We were given two documents, and a number of us asked, were they laid out in a matter of priority? We were given the understanding that they weren't, but you do feel that perhaps the ones that came up first on the list were those that were probably would be dealt with first. So I think it will be interesting and important that we get assurance that they are, dealing with it in a matter of priority. And I think it's important we see accountability in relation to the issues that we have raised as well, that they are taken into account on how the money has been spent.
Okay, thank you, Gordon. Kieran,
yeah, Chair, I agree with your comments and also Gordon's. But first of all, I want to say that I think somebody raised it as a point of order that the two very important topics were covered in that one large statement, and I think it certainly didn't give me the opportunity to answer or ask questions on both, because I did ask questions. I think I was told to cut it short or something, so there wasn't enough time on two very serious issues. Another one is we have been told here in the committee that 180 million quid was what was required. If we didn't get that, there would be serious consequences. And safe and reliable services is still the result of not getting that extra 80 million. Do you understand what I mean? We're not the health department is not getting the 80 million that was asked for, and the official told us, and we would like to, and that's supporting what you're saying, we want to know what is going to be the result of that 80 million not coming in, or is it going to be another beg and bowl to the Treasury 6 months down the line, or whatever. We want to know what's going to suffer.
Okay, yeah, and I'd absolutely agree, and that is why we're seeking that view from the department, because we want to know how that money will be prioritised or spent. In essence, if the original ask was 160 million, which then went down to 140, and there's now 80 in the system, how is that prioritised, how is that spent? So thank you for that. So I'm suggesting, members, we schedule that oral briefing with the department in early November. Yes, sorry, Kieran. Yes, the point that you make is a valid point as well. We should reflect that concern around the importance of those two issues and the timeline given for members to scrutinise it properly.
Yeah, I do really feel very strong, because I always think that it was a deliberate act to prevent members asking questions that they wanted to seek answers to, and that cannot be right. So
well, I think we should raise our concerns directly with the Minister and the Department on it, and take a view from them. Secondly, the issue that was of equal importance was the issue of the children's heart surgery, and there were again a comprehensive statement, but there's a lot of issues, I think, that still need clarification around this, and I think everyone is mindful that we have an independent expert's report, which is a good thing. But, however, there are issues around the gap in services from the Belfast closure from January 2015 until the capacity in Dublin is in place fully. So I'm suggesting that we seek a briefing from the department on the issue at our next meeting, given the degree of urgency. And I think that there's a number of issues around the gap in service, and I think also what people need to get a sense of collectively as communities and as families is what will be in place in Belfast and how will that support the work of Dublin. So if members are in agreement, we're going to seek that with a degree of urgency and try and schedule that for next week.
Great.
Thank you. Item 3, members, is the draft minutes of the meeting on the 1st of October 2014, page 5 of your pack. I'm just asking our members' content with those minutes.
Great.
Okay. Item 4 is the adult safeguarding policy, which is on page 12 of the meeting folder for the relevant papers. Just reminding members that the Department of Health, along with the Department for Justice, have been taking forward the development of an adult safeguarding policy. It's intended that the joint consultation on the draft safeguarding policy will issue shortly. So department officials are here today to give us evidence on the draft policy. We've Eilish McDaniel, Director of Family and Children's Policy at the department, and Linda Johnson, Office of Social Services. So you're very welcome. I'm going to invite you to make a 10-minute presentation, then we'll open it up to the members.
Okay, thank you. Chair, the committee has asked officials to provide evidence today in connection with the adult safeguarding policy, and at this stage you should have received a copy of the draft policy and the associated consultation paper. It's our intention to consult on the policy in the near future, and the development of the policy is one measure in a package of measures to improve safeguarding outcomes for children and vulnerable adults in fulfilment of a programme for government commitment. I would like to give members a sense of what the policy is intended to achieve, describe the key policy themes and set out our plans for publication. The policy promotes a zero tolerance of adult harm. It aims to prevent harm occurring in the first place, and when harm occurs, ensure that effective protection responses are made by police and social services, assisted by other agencies where appropriate or as required. It moves away from current vulnerable adult terminology, and instead it introduces definitions of adult at risk of harm and in need of protection. The point being made by the department is that while adults may have characteristics which increase their exposure to risk, risks are only realised when others abuse or exploit those characteristics or are neglectful of the needs which they may generate. The policy defines harm and abuse, which includes physical, emotional, sexual, financial and institutional abuse. It also recognises that adults can be at risk of harm due to particular life circumstances, for example, living in isolation, in poverty or being homeless. Unlike child safeguarding, safeguarding adults at risk requires consideration of the interlinked concepts of consent and capacity. Assuming that they have the capacity to do so, some adults may choose to act in ways or consent to things which others may not approve of or consider unwise. And in those circumstances, some adults may or may not want to be safeguarded by others, and the best we might be able to do is to help them make as informed a choice as possible. Where adults lack capacity to consent, we need to ensure that they are afforded maximum protections, and this is reinforced by the Mental Capacity Bill. The policy requires that links are made between adult protection processes and other established processes for dealing with victims of human trafficking, for example, or victims of domestic violence. And as I've said, the policy aims to deliver prevention and protection in equal measure. It places lead responsibility for protection with the police and social services, but recognises that prevention requires the efforts of us all in our interactions with adults at risk, in their homes, in the communities where they live, and in places where they go to partake in activities or to access services. The prevention of adult harm requires effective public health and community safety policies and strategies. It also requires individuals in both community and organisational settings to recognise harm and to know how to report it when it occurs, or as importantly, when it is at risk of occurring. In organisational settings, the policy promotes robust internal and external governance arrangements. In care settings, for example, in nursing or residential care homes, there is a key role for bodies like the RQIA, for care managers and contracts managers, all of whom need to have keeping adults safe firmly on their agendas. Likewise, those responsible for providing or managing care in those settings need to have robust mechanisms in place to ensure that the safeguarding needs of service users are being fully met. All of these messages are clearly articulated in the policy, which we aim to publish finally in March 2015. And this will require us to issue the draft policy for consultation in November. We have always considered that the adult safeguarding policy may need to be underpinned by legislation, and the research by the Commissioner for Older People is very timely in that respect. I welcome the Commissioner's research. It has coincided very neatly with the development of the adult safeguarding policy, which is a joint policy exercise between this Department and the Department of Justice. We have been engaging with the Commissioner in the course of her research, and officials attended a roundtable event organised by the Commissioner's office. And helpfully, we were given the opportunity to comment on draft research reports. And at the same time, drafts of the adult safeguarding policy have been shared with the Commissioner's office. It is intended to seek views on the Commissioner's legislative recommendations, and those issues she feels should be given further consideration as part of the consultation on the policy. And question 28 in the consultation paper deals specifically with the Commissioner's recommendations. While supportive of what the Commissioner is seeking to achieve, we have some reservations about particular recommendations. There is also the issue of recommendations being restricted to older people, which the Commissioner's remit clearly limits her to. Some recommendations, for example, the introduction of a power to enter an individual's home or a power to remove an individual where there's a real risk of harm, introduce a tension with an adult's right to autonomy and the right to respect for private and family life. And while we have reservations on those grounds, we have to acknowledge that a power to enter already exists in Wales and Scotland, where we understand the power is very rarely used. In addition, the police already have powers of entry in specific circumstances, and social services have the power to remove a person under the Health and Personal Social Services Order of 1972. And the Mental Health Order of 1986 also provides social services with the power to require that an individual who lacks capacity resides in a specific place for the purpose of keeping them safe. Also, the Commissioner recommends the introduction of a duty on identified relevant organisations to report suspected abuse or harm to the appropriate body. Under the Safeguarding Vulnerable Groups Order of 2007, which we're still in the process of implementing, there is already a wide-ranging duty to refer to the Disclosure and Barring Service in circumstances where a vulnerable adult has been harmed or placed at risk of harm. The Commissioner also recommends the establishment of an adult safeguarding board empowered by statute to act as an oversight body to protect older people at risk of harm. This would be the adult equivalent of the Safeguarding Board for Northern Ireland. We already have a non-statutory adult safeguarding partnership for Northern Ireland led by the Health and Social Care Board. It was established under policy direction from the Department and the Northern Ireland office prior to the devolution of Justice and Policing. We have some reservations about moving to a statutory model at this stage, in light of proposals to review the SBNI, which we can learn from, and the changing face of adult safeguarding in Northern Ireland. We recognise that legislative provision as it relates to adult safeguarding is contained in a number of statutes, and we appreciate that the Commissioner is seeking to bring those together into a single statute. Just to make the committee aware, the Northern Ireland Adult Safeguarding Partnership produced a short time ago a practitioner handbook which sets out all of the legislation considered to be relevant to adult safeguarding. Although we have some reservations about what the Commissioner is recommending, either because they cut across legislative provision which is already in place, or there are concerns about how they might play out in practice, it is intended to seek views on all of the recommendations in the public consultation exercise, which, as I've indicated, should start in November 2014. Chair, that concludes the presentation, and Linda and I are happy to take any questions from members.
Okay, thank you, Ailish, for that. Obviously an important piece of work. Just wondering specifically, a couple of things I picked up on. Obviously, there's the issue of safeguarding policy, but you referred to yourself that you'd always considered that should be underpinned by legislation.
Yeah.
And I just want to tease that out a wee bit more, because you then went on to say that there was almost reservations about some of the recommendations coming forward. Maybe just expand on that a bit, because I noted that you said that it may cut across some legislative processes that are already in place.
We do have legislation already in place in a number of different pieces of legislation, and I've given a couple of examples today. We've got the HPSS Order of 1972, or the Mental Health Order of 1986, which provides powers or duties similar to some of those being recommended by the Commissioner. And I've also made reference to the Safeguarding Vulnerable Groups legislation, which includes a duty to refer individuals who have harmed a vulnerable adult or placed them at risk of harm to the new Disclosure and Barring Service, which operates across England, Wales and Northern Ireland. If we do move to an adult safeguarding bill, and I'm not discounting that at this stage, I think we simply need to consider what other legislative provisions we've got elsewhere, possibly with a view to repealing those if necessary, and that's the only point that I'm making. I do appreciate what the Commissioner is trying to do by bringing it all together into a single place, into a single piece of legislation.
Okay, and in terms of the, you talked about it being reinforced by the Mental Capacity Bill. Just explore that a wee bit with you.
The policy, one of the key underpinning principles of the policy is that we need to consider the consent of adults to being safeguarded. Consent is very closely linked to capacity, so some individuals may not have capacity to consent at all. The reference to the Mental Capacity Bill is simply that it is intended to introduce further protections for adults who lack capacity. So what we're trying to do in terms of the policy is totally in keeping with what the aims of the Mental Capacity Bill.
Okay, and just, I mean, given again, and I'm going back to the point that this is obviously a policy which is due to go out to consultation. Have you timelines around that, first of all, and then second of all, if there was a decision that there needs to be a legislative approach to this, you know, what are we talking about there? We're talking about obviously the next mandate.
Absolutely. In terms of consultation on the policy, the intention is to go out in early November to conclude within 12 weeks of the commencement date, and to have a final policy in place by March of 2015. Obviously, then we need to consider whether or not we are going to progress an adult safeguarding bill, and it is highly unlikely that work would be done in time to introduce anything in the current mandate. And in our programme for government commitment, where we do refer to the possibility of a piece of adult safeguarding legislation, we do indicate that it would not be done in the current mandate. It will be for the next mandate. Impossible to do in the timescales is the point that I'm making.
Yeah, I suppose, I mean, just a general point, I know there's a couple of people, I suppose given some of the recent reports that we've heard in the media, both here and in England and elsewhere, around the abuse of our elderly community, both physical, and financial, and all sorts of formats. There is an importance for. I would have thought that I know that you're talking about the policy, but I'm making this just general point. There's important in terms of the North of Ireland stepping up in relation to this, and there's other models of how it's been done elsewhere.
And we have been looking very closely at what has been done elsewhere. We've looked at legislation in Scotland, and we're currently monitoring legislative developments in other parts of the UK. I mean, the policy is intended to be a starting point for us, and it supplements some of what the department has done in adult safeguarding terms over the course of the last couple of years. So we have engaged in awareness-raising activity, and I think that awareness-raising activity has led to the increase in numbers of referrals to social services. For example, we also thought it essential to put what we term the adult safeguarding infrastructure in place, and that includes the Northern Ireland Adult Safeguarding Partnership and 5 local area safeguarding partnerships, which are centred around each of the 5 trusts. So I suppose one of the other more significant things that we did too was to work with Volunteer Now to produce a set of adult safeguarding standards for use by the voluntary and community sector and the independent sector. So there are a number of building blocks, I think, that we've already put in place that will be supplemented by the policy and legislation. Then we take that to the next stage if it is confirmed and agreed that that's where we need to go.
Okay, but I mean, obviously the door's open in relation to those discussions.
The door is absolutely open, and that's why we're seeking views in consultation on the policy.
Okay, thank you for that. Kieran had indicated.
Yeah, thanks, Chair. Thanks very much for your presentation, and would offer support for the work you're doing. But would you have any, at this stage, would you have any idea of the numbers, we're talking about Northern Ireland, the numbers of vulnerable adults out there, or the scale that they are, of the abuse that they're open to at this moment in time?
Okay, one of the figures that I can, not numbers of vulnerable adults, but certainly numbers of referrals to social services on the adult protection side. I think in 2013 we had about more than 7,500 referrals to social services of an adult safeguarding nature. Now, I don't necessarily mean that means all 7,500 were actually abused. And that represents a 36% increase on the previous year. I think, as I said to the Chair, some of that, I think, can be attributed to the awareness-raising activity that has been undertaken both by departments and by the Northern Ireland Adult Safeguarding Partnership. So it's a significant number of referrals, and the number continues to grow. Within the Programme for Government commitment, we set a target for the numbers to increase over time, and that has proved to be the case.
How does it compare with other regions? Would you know?
Off the top of my head, no, I don't know.
And finally, who are the main partners in the community and voluntary sector that can best assist you for prevention and detection?
I mean, there are obvious voluntary and community sector organisations of relevance. AGNI is an obvious example, but the adult safeguarding partnership arrangements include representation from the faith sector, for example, because the faith sector does very valuable work with vulnerable adults, predominantly in their home or through activities organised by the faith sector. There's a pretty significant membership of both the regional and the local partnerships by the voluntary community sectors. Okay,
that's working together. We can over. That's grand, Chair.
Thank you, Kieran. Fergal next.
Yeah, well, yes, thank you very much. Pardon me. It's my frog in my throat. Can I just ask you, what's the definition of harm? How is it measured?
Okay, I'm going to turn to my learned colleague on the right here, but I'll start by saying that we define harm as something which consists of both of abuse, of exploitation and neglect. And Linda can say a bit more about the different kinds of abuse, for example, that the policy actually refers to. I think I've given examples to you in the opening statement. I mean, we're talking about physical abuse, financial abuse, sexual abuse, obviously.
That's abuse.
Yeah.
But how do you define harm?
Harm we've looked at in terms of the impact that it causes on the victim or the person and how they experience that. So it may not be a major incident, but there may be a major impact on the individual. So in terms of the criteria of harm and serious harm, it's very much based on the discussion, the professional judgment, the working with the person in their circumstances to understand how that harm is impacted on them.
So it's about how it impacts, but how do you measure that if, for example, two different people react differently to what could be a guarantee or could be recognised as a single act, but I don't see it as harm, but somebody else might?
Well, it's working through with that person what their choices are in their circumstances and how they, I mean, the response will be determined by what that person wants to see as the outcome of that incident. So it's not so much about, it's the impact of harm having occurred and then what are you together going to do to address it and what will be the best outcome for that person and who needs to be involved in achieving that.
But my question is centering on how do you measure it? How do you satisfy those in authority that in fact harm has been caused if, on the one hand, I feel that was a harm caused to me, but on the other hand, a colleague or somebody may not feel that?
Well, there are a number of thresholds contained in the policy in terms of looking at the measurement of harm and what might constitute serious harm, and that might be about the frequency of an incident or the number of people that it affects, if it's one person or if there's a risk to other people. As I said, there's a range. It's not so much a scale. It's just looking at in that person's circumstances. Is there a threat to others? What's the threat? Who's it from? Is it from somebody close to them? Is it a family member, a member of staff? So there's a range of thresholds that will be applied, and that will be a matter, as I say, for discussing with the professional and the person.
And could harm be caused by neglect in this sense, in the lack of provision of something?
Well, I mean, and yes, that's one of the things in looking at are people's needs being met, how are they being met, are they being met appropriately, and if a person is not being provided with the service that they require or somebody has neglected to provide for medications or provide for some aspect of their care, then yes, that would be deemed to be
So in that context, then the absence of legislation around goods, facilities and services could itself be seen to be government harming because there isn't we don't have that legislation here.
But I mean, under the HPSS order, for example, I mean, there's a duty to provide health and social care services to people who are deemed to need it. I'm not quite certain where you're coming from.
We don't have in England, for example, they have the 2010 Equality Act, which allows for people to access services as of right. We don't have that legislation here, so I can be denied at a certain age, facilities, goods, services, education, etc., etc., etc. So
the Health and Personal Social Services Order would require that where the assessment identifies needs to be met, that it is the duty of Health and Social Care to provide for those needs.
We don't have the legislation here to back that up in goods, services and goods, facilities and services legislation. As I understand it, it exists in England under the 2010 Act. So you're legislating for when harm comes, but as far as I can see, there's a gap in the market because we can legitimately not provide for somebody. A 75-year-old could be denied if there's limited cancer drugs or limited. A 75-year-old could be denied that drug in preference for somebody else who's younger. Isn't that harm?
Well, there's a requirement as well, under that, the Health and Personal Social Services Order to provide for assessed need. So if the assessment is there, then there's a requirement to provide to meet that need. And
well, specifically, it's not the case because, for example, in the cancer drugs, I don't want to lean on this as the issue, only illustrative. But in fact, where we know there are drugs available, they aren't provided, so that's not true. But there's a gap here. I mean, in other words, aren't you reaching beyond for the harm? And it's not I'm not saying it's bad, idea. I'm just saying, doesn't it point up that there's a big gap here in terms of our legislation, which I understand is sitting in OFM, with nothing happening?
Well, I think maybe one of the things that we do need to look at, I mean, I'm not familiar with the 2010 Act that you make reference to, and maybe that's one of the things that we actually need to look at. But the point that we're making is there is legislation in place in Northern Ireland which requires us to provide health and social care services to those who we've deemed to need it, and I don't think that we can disregard that legislation already exists.
If you accept the point that I'm making, that it's pointing to another gap here, in the sense that people can be discriminated against by virtue of their age. And you're saying that there's the potential in a negligence or in a way that shows that treatment or facility has not been provided, that could constitute harm.
It depends on whether it actually does constitute harm. I think it is the point
at which
and I understand your question. Yeah.
Which is why I'm asking what is harm and how do you define it? And if you're taking it right back to just a sense of harm in the individual, then you're going to protect somebody against potential harm. On the other side, that person hasn't the right to that facility or service. Has a right.
I mean, the policy has scope. And I think the policy is limiting the definition of harm to abuse, to exploitation and to neglect. And we do define what we mean by abuse, and I've given you the examples of what they are. I don't think that the policy will be able to... No,
and I'm just pointing out...
to deal with any form...
It's legitimate to point out a potential flaw in the thinking.
Okay.
Yeah. Thank you. Thank you, Chair.
Thank you, Fergal. Rosie?
I'm Gurmai Carey, and thanks very much for the presentation. Can I ask, see, according to cases where people have experienced harm, which setting is most likely to be the one where most people, or the majority, is there a setting where most cases arise out of?
I mean, we have statistics based on programmes of care. For example, I think for 13-14, the greatest percentage, I'm going to give you in the form of a list, the greatest percentage of referrals, again, to social services, again, not necessarily confirming that adults were actually abused. In terms of percentages, older people were at the top of the list, followed by adults with a learning disability, those with mental health difficulties, next physical disabilities, and then the fifth category is referrals from hospital social workers. Now, that doesn't necessarily answer your question in the sense of where is that happening. It can be happening anywhere. It may be happening in an institution, in a nursing home or a care home, but it could also be happening in an individual's own home. I think we do have a figure for institutional abuse, and the percentage is really very low for the latest published statistics. It's of the order of 1%, but that doesn't necessarily mean when there is a referral relating to an older person, for example, that older person wasn't residing in a care home. The statistics are difficult to read, and I think what we've concluded is that we probably need to be a bit more sophisticated about the collection of statistics. Maybe collect information differently from how we're collecting it currently, or collect more information that we're not currently collecting.
Yeah, I think it would be important if you can identify where, if there is somewhere where it's more likely to happen than other places, that a focus would be, maybe a greater focus would be put there. And I know probably everybody's aware of the kind of cases that you see on television, and I'm reminded of those ones that happen in a private home where there's a carer comes into the home. And I'm wondering how your policy does it stretch far enough to cover those circumstances, because it seemed to me that families had to put in photographic equipment to get the evidence to prove what was going on, and so I think that presents difficulties. And will your policy cover that? And another aspect of it is, and I'm talking about a particular case that was brought to my attention from a constituent, and it was a person who is a carer, and
she was accused by an elderly person of stealing. Now, I know that can happen when people have Alzheimer's. It's a feature. And but that person was suspended from work, and I would argue suffered great harm psychologically and emotionally, and hasn't been the same person since. So, does your policy cover harm experienced by the carers as well, by people who are probably now, when I think about it, are put into vulnerable situations by the nature of their work? They're made vulnerable by the nature of their work. I understand the complexity of it, but nevertheless, there are different kinds of harm, and I'm wondering, will your policy cover the whole range of circumstances where people can experience harm?
It's intended to cover all of those circumstances. I mean, I think the key thing about the policy, which probably sets it apart from policies that we've had linked to adult safeguarding in the past, is the emphasis on prevention. So I do think there are a range of measures that can be put in place to ensure that harm doesn't occur in the first place. And I think key to that will be the empowerment of individuals. So that individuals are facilitated as much as they possibly can be to keep themselves safe. I mean, financial abuse certainly is covered by the policy, although I don't think it's quite covering in the way that you are intending it to be covered. Is there anything you want to add, Linda?
No, I mean, I think it's the breadth is that safeguarding is everybody's business, and everybody needs to respond no matter what the setting. And taking your point about the carers and suspension, and there are very complex and difficult processes which the police and social services will manage, and it's difficult for everybody working through those investigations, and we're all too aware of the impact that it does have on others. We haven't addressed the impact on others in the policy. It deals with the impact on the person who's being...
I mean, it strikes me that, because that person was in a sort of a state of shock about what happened as a result. So perhaps if maybe employees are alerted to the fact that in the circumstances this is what will happen, but it's a process and it's the procedure, and you shouldn't be alarmed by it. And maybe if you're prepared in advance, it wouldn't be the same shock. But that person, after maybe 40 years of working in the sector, was deeply shocked at how she felt she was treated, and in retrospect, probably was treated fairly, but she didn't see it that way.
Yeah, and I think there will be a range of other policies and procedures which will need to be reviewed in light of the direction of this policy. So that's certainly something which, more operationally working through procedures, needs to be addressed.
Okay, thank you for that. Gordon?
Thanks, Chair. Thanks very much for your presentation. In relation to the safeguarding policy, do you see it as being proactive, or will it be reactive to different situations? What is it really being objective?
It is both of those things. I mean, I've said in my opening statement that it is designed to deliver prevention and protection in equal measure. I think we serve adults at risk better by seeking to prevent them being harmed in the first place, but we absolutely need to make certain that when they need protective support and responses, that those protective supports and responses are there, and principally protective responses are provided by police and social services.
So do you feel the priority will go on to prevention? Would you feel that's what you would want to come out of this policy?
I think we want a focus on prevention, certainly, without taking our eye off individuals who might have been harmed. But the aim of the policy is to put a range of measures in place that deliver a preventative agenda.
I think we're all shocked and distressed and very saddened to see what has happened in the institutional abuse cases that are in the media. It's unbelievable, I think, that these things happened within recent years. It is relatively, recent. And in this day and age where we feel there's openness and there's there's ways of reporting, there's systems in place and there's processes in place within institutions, within organisations, within government agencies, and yet this happened. Now, what assurances can you give to us that this will not reoccur following the implementation of the policy?
I couldn't possibly give you that assurance at all. I mean, I don't think you could say definitively that as a result of this policy that no older person, no adult with a learning disability will ever be
No, I appreciate that,
abused,
but really,
again.
you've already said it's, the emphasis is on prevention. So, institutional issues, I think, are huge issues, and they're so shocking and so distressing to think that that happened within our lifetime. And no one knew about it, and no one seemed to take any action on those issues. So what can be done to stop recurrence of such cases again? And I think that's important, that any policy that's put in place. And the policy is only one thing, of course. It's how it's going to be actioned, carried through, and how the things are addressed is more important.
Yeah. The policy message would certainly be that the governance arrangements, both internal and external, for all organisations need to be strengthened, and so the regulation, the commissioning, the contracting, care management role, all of the professionals involved and all of those who are managing the care need to make sure that all of those processes are pulled together and triangulated in a much stronger way, so that the policy message would certainly be that there are triggers and there are signs, and we need to be picking them up earlier, and the early intervention and the prevention message is intended to make sure that those issues are surfaced and brought forward, and that the appropriate reporting mechanisms are in place. And they, as I say, this policy would need to be underpinned by the more operational policy and procedure to make sure that that takes effect. But that's definitely our message. This needs to be stronger in terms of picking up the triggers.
We need to see openness and transparency. Yeah. And how do we assure the man on the street that that's going to happen? Through the RQAA?
RQAA is one of the key players, and obviously training and...
Sorry, go ahead.
Training and raising awareness among staff, the registration as well of social care workers is a key tenet of making sure that everybody coming into the care sector is appropriately registered and their professional standards are overseen. They're referring to the disclosure and barring service, where there are any individuals who are detected in the system, that they are referred to that list and that they are prevented from seeking alternative employment. So there are a range of measures which, as I say, if pulled together, should help to strengthen that.
Okay, and just on one of your points is about consent-driven approach. Consent. What happens if that consent is not forthcoming? How do we ignore the case, or how do we work around it?
I think, again, I said in the opening statement, assuming that the individual has the capacity to consent, because that's a key consideration. It just doesn't simply mean that you walk away when somebody says, I don't want you to be involved. It's about working with that person to ensure that they understand the choices that they are making, and providing them with as much information as possible to help them make the best possible choice. So there is working with the individual, not just simply walking away when they say they don't want social services, for example, to be involved.
Okay, just finally, just thinking, how do we and how do you inform the public out there about what abuse really is, and how people can be more alert to the risks there are to their families, to the public generally? And what is planned to be done to try?
We've already done some of that. A few years ago now, the department working with the Northern Ireland office produced a number of different awareness raising leaflets. One of them was targeted at the general public, and the other one was targeted at staff working with adults at risk. And I've made the point already. I think some of that work has probably led to the increase in the numbers of referrals now being made to social services. So I think we can say with greater confidence that people are probably more aware of adult harm and the effects of adult harm, and are less willing to walk away when there's evidence that an adult may be being harmed.
Will increasing public awareness be part of the implementation of this policy?
I think we need to consider what else we can do in terms of public awareness raising. I think let's get the policy in place first of all, and then supplement that with a range of other things. The legislation is potentially one of those things. Awareness raising is also part of the picture. And I think the Northern Ireland Adult Safeguarding Partnership has engaged fairly significantly in awareness raising activities, and that's part of their strategic plan.
Okay, thanks very much, Eddie. Thank you, Chair.
Thank you, Gordon. I have Michael next.
Okay, thanks, Chair. Thanks, Eilish, for your presentation, very comprehensive. There's a couple of things. It's clearly, with your aims of your policy, this is a very difficult area and a very difficult ask, promoting zero tolerance of harm and so on, protecting people. I can see, as Gordon talks about institutions, you can see you can put in mechanisms in place, safeguards in place that can bear down on that. But you have, 7,500 referrals of adult abuse a year. It's up 36% since the previous year. That's a huge jump. So you've got a very big task here in terms of policy. And I note your older people, learning disability, mental health, the hit list of victims. You also refer then to mechanisms that interface with adult protection arrangements, and that's what would interest me as well: domestic violence, human trafficking, hate crime. What sort of percentage or what sort of size is that problem in terms of the overall that you're looking at, and how can you impact on that more than say that you have the police there and courts to deal with that, and you have the policies there around domestic violence and working with the police. But I'm not quite clear how you think you can impact on that through your policies.
I mean, I think there is a direct link between the policy and policies governing other things, including human trafficking and domestic violence. I mean, we already have arrangements in place to deal with the highest, the most at-risk victims of domestic violence, for example. So we have what we call the MARAC arrangements in place, which are police-led. The general messages from this policy are relevant, are as relevant to victims of human trafficking and victims of domestic violence as they are to adults more generally. And that's why the policy does say that adult safeguarding, generic adult safeguarding, needs to make certain that it is connected with those more specialist responses to either victims of human trafficking or domestic violence, are the two examples that we actually give. I mean, there are figures for human trafficking for Northern Ireland based on referrals to the National Referral Mechanism, relatively small in number. In terms of numbers of victims of domestic violence, I couldn't tell you off the top of my head how many victims we have in Northern Ireland, but I can tell you that information is actually collected through the MARAC arrangements.
Okay, that's fine.
Thank you, Michael. And Mickey next.
Yeah, thanks for the presentation. It was more of a comment really, because you talked about statistics earlier. I read an article, I think it was about 3 years ago, and it was really around elder abuse. But they're saying in the article that about 4% of the population, elderly population, were in residential, but 23% of the calls to the helpline came from residentials. So it's totally disproportionate. But I think you did say you need to be more sophisticated. And if you're going to go on an evidential basis, obviously you do, because that seemed totally disproportionate. You know, and obviously as our elderly population increases, there's going to be more and more need for drilling down into the type of complaints and the safeguards that are put in place, and of course prevention. It just seemed, you know, that at that stage, and you were saying there that it was 1%, I think. So it would seem again as if things are going down, but there's no evidential basis for that.
No, I think I've made the point that we probably do need to be slightly more sophisticated than we are. in terms of data collection.
Maybe a lot more sophisticated.
And I think we're already, there have been improvements made, certainly over the last number of years, with the introduction of the new partnership, adult safeguarding partnership arrangements, and the appointment or establishment of specialist posts within our health and social care trusts, for example. A bit more work probably to be done, but the point I'm making is I think that there has been fairly significant progress made over the course of the last couple of years.
Thank you.
Okay, well, look, can I thank you for that detail today. I think what you're hearing today is it's important, obviously, that we advance with consultation around policy. But I do think that the focus is on the fact that we have increasing incidents of abuse, and that's documented through the partnership themselves. Figures I looked at was up to from 1,715 in 2011 to 3,023 in this year. And if this is ultimately about prevention and protection, then that does need to be underpinned, in my view, with some sort of legislative framework to do that. And I think we have an opportunity to step up in relation to this one. So thank you for your presentation today, and we look forward to continuing the conversation as this develops. Thank you.
Thank you very much.
Okay, members, item 5 again, the same issue. Want to refer members to page 113 of your folder for the relevant papers. Just advising members of the Commissioner for Older People and Professor Williams, I understand, are here today to give evidence on the draft safeguarding and specifically on the case for introducing specific legislation. You're very welcome, both of you. Good to see you again, and welcome to the committee. I'm going to invite you to make a 10-minute presentation, then we'll open it up to conversation and questions from members.
Thank you very much, Chair, and good afternoon to all the members. Those of you I've had the pleasure of meeting before, and welcome to the new members of the committee. It's nice to see you. Could I start with saying, first of all, thank you very much to you for agreeing to hear directly from myself and Professor Williams on this most significant issue of abuse against older people. It is absolutely imperative that our legislation, policy, practice and guidance both prevents abuse against older people and protects older people who experience abuse. And it should also be clear what interventions are available in the event that abuse is suspected or detected. And in my first corporate plan, called Hope, Confidence and Certainty, I committed to undertaking a review of the legislation and the adequacy and effectiveness of both law and policy in relation to older people, so that they are better protected from a range of different types of abuse, including physical, emotional, sexual, financial abuse and neglect. And this priority focus for my work really did follow extensive engagement with older people, with older people's organisations and professionals working with older people who expressed considerable anger and indeed revulsion about increasing numbers of reports of alleged abuse. And on examination and with further consideration, I was convinced that the legal framework to protect older people from abuse and to assist those older people who experience abuse also required specialist review. So I commissioned research from Queen's and the University of Ulster to review the legislation in Northern Ireland. Now, make no mistake about it, abuse against older people is universally condemned in our society, absolutely. But it causes incredible fear and distress to older people who are at risk, as well as to those who experience abuse. And it can take many forms. I know you've had questions before, but including physical abuse, emotional abuse, sexual abuse, financial abuse and neglect. And the impact can have absolutely devastating consequences for older people. And sadly, there are thousands and thousands of older people across Northern Ireland every year being abused, often and usually by somebody with whom they have a relationship of trust and on whom they ought to be able to depend. And the number of those reports of abuse is increasing. We have to have a better situation where older people can have confidence that if they experience abuse or they are at risk of abuse, the law can adequately protect those and it can punish adequately those who carry out abuse. As it stands now, there is no single piece of legislation to protect older people from abuse, which means that those who are vulnerable or at risk of abuse are not afforded the same legal protections as their counterparts in England, Scotland and Wales, Cymru, all of which have dedicated laws in place to protect all older people from abuse. So I am calling for legislation to protect all older people from abuse, recommending that legislation should include a clear definition of what abuse is, who is at risk, as well as clearly outlining the responsibilities of those who work with older people. There are clear gaps in the legislation that we have currently, which mean that there are some areas where older people are not protected from abuse. The legislation is disjointed and it draws on a very wide range of different laws. The current position offers different protections to those individuals who lack mental capacity compared to those who have mental capacity, with those with mental capacity not afforded the same protections from abuse. Any new legislation, and you've heard earlier in conversation around the table from committee members about protections as well as rights, and certainly any new legislation must strike a balance between protection and prevention of abuse, human rights and the law to ensure the best possible safeguarding of older people who either are at risk or experience harm. There is a wide misunderstanding, I think, of what constitutes abuse, and the World Health Organization's definition simply says it is a single or a repeated act or a lack of appropriate action which occurs within any relationship where there is an expectation of trust which causes harm or distress to an older person or violates their human and civil rights. So it is an act of commission or omission. But of course, in reality, older people can be abused in very many ways. And the 5 most common forms of abuse, as stated by the campaigning charity Action on Elder Abuse, are physical, psychological, financial, sexual abuse and neglect. If you think about each of those, they carry very different ways that they're carried out. They may be carried out by different people, but the impact is absolutely devastating. And the abuse can be carried out, of course, by family members, by friends, by volunteers, by neighbours, health and social care employees, any other statutory sector employee, community volunteers, anybody who would get close to and would lean on an older person who is vulnerable is who commits abuse. There are questions about the prevalence of abuse. The only really available prevalence data suggested for abuse against older people in Northern Ireland is estimated at 3% of the older population in a 2007 UK-wide study of abuse and neglect, and that is extrapolated data, not specifically related to Northern Ireland. But the Northern Ireland Adult Safeguarding Partnership has reported over 3,000 adult safeguarding referrals, with 39% of the regional total to the older people's programmes. This, I'm afraid, is a 43% increase in reports of adult safeguarding cases in relation to older people from the previous year, which was 2011-2012. And last year, the most common types of abuse against older people were physical and financial abuse. And in 2013-14, almost half of all of the adult safeguarding investigations commenced and almost half of the care and protection plans implemented concerned older people. Yet our existing legislation is complex and practitioners have to draw on a wide range of different pieces of legislation to carry out their duties, include the Family Homes and Domestic Violence Order, Criminal Law Act and the Terrorism Act. And of course, while safeguarding professionals can make use, and effective use, of existing legislation, the legislative intent for 2 of these pieces of legislation was not to safeguard older people, and practitioners are indicating that the complexity and disjointed nature of the law is unhelpful to them. And as the Commissioner for Older People, obviously my authority is to advise Government in relation and in the context of safeguarding and promoting the interests of older people, which is defined as those aged over 60 and exceptional circumstances those aged over 50. However, I do recognise that the proposals that I'm putting forward would offer improved legal protection to all adults at risk of harm or abuse. All people should be protected from harm or abuse, and new adult safeguarding legislation would assist in providing that. There's currently a disparity of protection within existing legislation for people who have mental capacity and those who are assessed as having a lack of mental capacity. Because for older people with mental illnesses, including dementia, there is a higher a higher level of protection afforded through the Mental Health Northern Ireland Order. And the Emerging Mental Capacity Bill will provide increased protection for older people who lack mental capacity. But there's currently no specific legal protection for older people in Northern Ireland who have the mental capacity to make decisions. And colleagues were referring earlier to that question of cooperation with social services and people who have mental capacities right to make their own decisions. But there is no specific legal protection for people who have mental capacity to make decisions, but who may be under coercion, threat, pressure or intimidation from people with whom they have a relationship of trust or dependence. And the recommendations in my report focus particularly on addressing this gap and improving protection to all older people at risk of harm. I've commissioned a team of academics from Queen's and the University of Ulster to make recommendations, and they identified a very disjointed array of legislation. And I've then engaged with a wide range of older people's organisations, professionals in all sorts of adult safeguarding and other organisations, but who work with older people to test out those really to test out how useful new legislation would be and to explore some of the specific detail of the powers and duties that new legislation could bring. And this told me very, very clearly that professionals working in the field, people trying to build therapeutic relationships with older people trying to protect them from abuse, people trying to intervene effectively without making things more difficult, without making it worse, those professionals are calling for better and clearer protection for older people and clarity, absolute clarity in a number of areas, including statutory definitions, people's legal duties and legal powers that they have. And my call today is for a new single adult safeguarding bill. It should provide clarity, as I've said, in relation to definitions, duties and powers, which would apply to all employees and organisations that are listed under the specified relevant organisations, which again should be outlined in future legislation. The areas where I believe there should be changes required in relation to definitions, we need a definition of what is a person at risk. And again, you're picking up those questions already in your questions to colleagues from the department. There should be a clear and easy to understand definition of a person at risk of harm or abuse. Good afternoon, Paula. It should be clear what the abuse or harm is. What is it the person is at risk of and what constitutes harm or abuse? We need a clear legislative definition of financial abuse in particular. With reports of allegations of financial abuse rising, we need specific legislative reference to financial abuse. And I would seek an adult safeguarding board to be created to act as an oversight body to protect older people. Placing statutory duties on people who work with older people, and some of these are quite shocking that they're not already in place. We need a statutory duty to report any suspected cases of abuse or harm on all identified relevant organisations. We need a duty for the most appropriate organisation to make inquiries or conduct investigations when a referral is received. All relevant organisations working with older people who are at risk of harm or abuse should be bound by a duty to provide appropriate services, including advocacy support for that older person. And throughout the safeguarding process, again quite shocking that it's not in place, all relevant organisations should be bound by a legislative duty to cooperate with each other in order to best protect the person who is at risk of harm or abuse. In order to deliver that, I'm suggesting that we need specific new powers to protect older people. These would, of course, only be used with the appropriate safeguards in place, but there should be the power of access to a private home or residence for the purposes of conducting a private interview with the person who is believed to be at risk of abuse or abuse taking place, where access is not being granted. Now, reasonable cause could be tested through application to a district judge, and it only would be implemented if it was not going to result in the older person being at greater risk. But that private interview has to be able to take place without the person being present who is suspected of committing the abuse. It is a nonsense not to have that in place. I also recommend that there should be protection from civil liability from anybody who makes a report of suspected abuse. And further support for whistleblowers, because again and again we see whistleblowers do not feel protected, they do not feel safe and are discouraged from reporting their concerns. There are a number of additional considerations which I personally, in my role, believe should be included in legislation, but I think warrant considerable further discussion and consideration. The first is the consideration of a power of removal of the person at risk and the power to ban a suspected abuser from the home. Remember, much of this abuse of older people is taking place by family, friends and neighbours in their own homes, by people with whom they have a relationship and on whom they should be able to depend and trust. England and Wales have considered those powers, and Scotland has implemented them, and further consideration of these powers for Northern Ireland at this time would be very important. I'm also requesting further consideration of the power to access financial records available in Scotland but not in England and Wales as a clear indicator to collect evidence in the event of allegations of financial abuse. But nonetheless, I would advise an implementation of an immediate campaign to highlight the signs of financial abuse and the impact that it has on older people across all our financial institutions, so that reporting and investigations of complaints of alleged financial abuse are actively encouraged. I'd also request consideration of the introduction of a specific criminal charge of elder abuse, where someone commits a crime against an older person by way of their action or neglect. It's not available at this point anywhere in England, Scotland or Wales, but we do have a chance, an opportunity in Northern Ireland to lead on that, and I think it is a very important consideration. And finally, I'd ask for consideration of a specific criminal charge of corporate neglect. This charge would mean that any organisation where employees, or indeed its directors, managers or owners, who are found to have committed abuse or neglect of an older person could be held liable for the actions of those employees. And in conclusion, a single adult safeguarding bill would ensure that in Northern Ireland we have a clear and defined legislative position on which to develop further good practice. And you're absolutely right, you've all said it at different times when I've been in the committee, legislation by itself will not comprehensively protect older people from abuse. Our attitudes need to change, our awareness needs to change, our respect for older people and their rights needs to change, and detailed guidance, training and resources and public awareness, with the commitment of the public and the commitment of all relevant organisations, needs also to be in place. This together will ensure improved protection from older people. And I'd urge this committee really to support the introduction of a single adult safeguarding bill to be enacted, Chair, at the earliest possible opportunity without delay. And I would encourage you to have that conversation and to implement that legislation as a matter of urgency. Thank you very much.
Thank you, Claire, for that very concise and direct ask. Just specifically, and I had the opportunity to attend your recent report, and I'm looking towards yourself, Professor Williams, because I know that part of that discussion at the report launch was around the models and the legislation outside of the north of Ireland, and you had some examples of that. So I want to tease that out. You know, if we were asking you the direct question, what has been the correct fit? What has England, Scotland, Wales done well, not so well? What are the lessons, I suppose, for us?
Okay. Firstly, many thanks for inviting me to attend the committee. It's a great pleasure and privilege to be here. I am an advocate of legislation or legislative framework to support adults at risk. There is clearly a human rights issue, and I hear that I hear the argument that much of what might be proposed looks as though it violates the Article 8 right to autonomy, which in fact is why I think legislation is important, because one thing you will get with legislation that you won't necessarily get with just policy and guidance are adequate safeguards and protections against the misuse or the abuse of any statutory powers. And I think also we have to look at the Article 8 right to autonomy, if I can put it that way, and balance it against the Article 3 of the Convention, European Convention, right not to be subjected to inhuman and degrading treatment. So within any legislation, there's got to be a tension between those two rights. There's got to be a calculation as to whether intervention in that particular case is appropriate. Now, it's very interesting, I think, to look at the Scottish legislation, and really we can put England, Wales and Scotland into three bands. We can have England as the minimalist approach, Scotland as the maximum approach, and Wales somewhere in between. The Scottish legislation does provide significant powers of intervention. The lesson from Scotland, however, is that that has led not necessarily to a use of those powers, but rather to more preventative work. There is something about having the power and telling an alleged perpetrator we can do this that makes that person think and enables preventative work to take place. So that's a kind of maybe unexpected consequence, but a very helpful consequence. The Scottish legislation does have a range of powers, including in the extremis, the removal of the person at risk or a banning order banning the perpetrator. Now, that really does have to be packed with safeguards, but as I say, in extreme cases, that can happen. The one very useful thing about the Scottish legislation is that you have a set of general principles that must be considered when you're contemplating using any of the powers. And that's about involving the person, that's about minimising risk, that's about respecting their decisions. The English model is, as I say, the minimalist model, which is basically the new CARE Act, the 2014 CARE Act, provides for a duty to make inquiries. Now, I say that's minimalist. That actually is a very valuable power, because up until now, unlike child protection, there has been no clear and unambiguous duty on local authorities in England and Wales to investigate cases of suspected abuse of adults at risk. That is useful. That actually is as far as the English model goes, other than an important duty to cooperate. Wales has a duty to make inquiries. It also has introduced what are known as adult safeguarding and protection orders. Wales considered going down the path of Scotland, but rejected it. What the adult safeguarding and protection orders, APSOs, actually involve is the right to apply to a court for an order allowing you to enter premises in order to interview the person in private. One, to see whether they are an adult at risk. Two, to see whether they are acting of their own free will. I'll come to that in a moment. And three, if they are both of those, to decide what action should be taken. If I might say, and coming from Wales perhaps I shouldn't, but if I might say, my concern with that model is you go in, you find they're an adult at risk, you find that they're not acting of their own free will, you say there are things that need to be done, and all you can do then is leave. And that, of course, runs the risk of exposing the person to even greater harm, because the abuser now knows that the statutory services are involved, and actually they can't do any more in terms of their powers. So that, I think, is a problem that we're really wrestling with in Wales, how to address that limited form of intervention. There is no power of removal, there is no power of banning, there is no power, actually, of just taking the person out to have them assessed. And I think that's something, if Northern Ireland does decide to go down the route of legislation, that, I think, is an important thing to consider, whether you need actually to go further than the Welsh model. Otherwise, as I say, you do run the risk of exposing the person to greater danger. The other issue that all three nations, I think, have wrestled with is this idea of consent and autonomy. And I entirely agree that consent and autonomy is critical. The question is, to give a valid consent, you need capacity, and Claire has mentioned the mental capacity bill that's proposed in Northern Ireland. We have our Mental Capacity Act. So there's a capacity issue. There's the importance of making an informed decision. What are the options here? But critically, the third element of a legal consent is it's made of the person's own free will. And we know that in abusive relationships, it is power. Yes, you are absolutely controlling the person every moment of their waking day. You are controlling them. Their ability to make decisions freely is seriously inhibited. And that's a factor we've got to bear in mind. It's a crucial factor, because if that's not present, if free will isn't present, it's not a valid consent. And that's a huge problem for all three of the other nations to wrestle with. I don't actually think that Wales and England have really addressed that one. That's a difficult. So basically we have the spectrum, the English model, the Welsh model, and the Scottish model. As I say, the very interesting thing about the Scottish model is that it's led to more preventative work rather than more statutory use of powers. I like the idea of one piece of legislation because I think the safeguards are critical and they need to be in one place. I don't think we should shoehorn adults at risk into other bits of legislation that weren't really designed to deal with the issue.
Okay, thank you for that. I have a number of members that indicated. Kieran first.
Thanks, Chair. Thanks very much for your presentation. It's good to see you back with us, Claire.
Nice to see you too.
I'm going to ask you the same questions as I asked the former guests, and I think you were in the room, and that is, have you any idea of the scale of the abuse that's taking place in Northern Ireland and what sort of exploitation is involved there? And also, who do you regard as the best partners in Northern Ireland to help overcome and prevent and detect abuse from the elderly?
Okay. The best answer I can give you on the suspected prevalence of abuse is 3% of the older population, which is considerably more than the number of reported allegations of abuse. In terms of the kinds of exploitation that take place, they are everything that you can imagine and some things, frankly, that you can't. They are sexual abuse, involving everything from rape, sodomy, violence, unwanted touching, a deeply unpleasant variety of assaults. They are financial abuse, which is everything from taking the change out of a £10 note when somebody's gone to the shop, to separating people from their homes, their independence, their opportunity to spend every penny that they ever had. They are physical abuse involving hitting, slapping, pushing, shoving, broken bones, pushing down stairs, threatening people, threats of abuse. They are all of those sorts of things, and they are neglect. They are the kinds of neglect where somebody doesn't get taken to the toilet, they don't get assistance with eating, they don't get food put near enough to them, they don't get taken anywhere, they don't get out, they don't get the company they need, they don't get the things that make their lives full and rich. And so all those kinds of exploitation take place, and they take place in people's own homes and in care settings and in hospitals. They take place everywhere where somebody would choose to exploit an older person who is vulnerable.
Right.
And your last question about the best partners, Kieran, I think the answer, I don't mean this to sound insignificant, but it is all of us. The best partnership for older people to be safer is that we recognise the gravity and the prevalence of abuse of older people, and we stop just condemning it, and we do much more practically both to prevent it, to protect older people, respect them and value them in the first instance. The secondly, we have legislation and practice in place which places duties and powers on those relevant organisations who work with older people to intervene directly with absolute clarity about what they can do and to be decisive. And finally then, the other organisations who work with older people, that best partners you talk about, are all of the organisations which work with older people. It is all of them, every single one. And they all have to be the best partners in that by legislative requirement and policy and practice. They have to be. It's not optional. They have to be able to deliver.
Thanks very much. And finally, you mentioned the question of whistleblowers. You probably are aware that our former Health Minister was very supportive
Indeed.
of the whistleblowers. I don't know what our present Minister, whether he'll carry on, but there is always the fear of the whistleblower that they'll lose their job or something will happen to them. Do you think that the department is big enough to overcome that and get the message out that whistleblowing is acceptable and indeed to be encouraged?
I think we do need more support for whistleblowers, those people who are working in organisations where they see something going wrong, where the safety and security of older people is at risk. We do need better protection. The former Minister was indeed very supportive and very encouraging of whistleblowing. However, I am absolutely convinced that whistleblowers or potential whistleblowers still do feel very, very vulnerable, and a large number of people who would otherwise report don't, and those who do whistleblow do very often feel intimidated and squeezed out of their roles. And I think those people who work in care settings absolutely have to be encouraged, not only by ministerial requirement and encouragement, but also by better protection for them, better advice and information for them, and support for them going through a whistleblowing process, and also redress for them if they are unfairly victimised.
And finally, do you think that the finger could be pointed at the Department of Health itself in that you mentioned one of the criteria for abuse is neglect, that in some circumstances the department is neglecting people by refusing to provide community meals, for instance. Community meals, Meals on Wheels, we all know. You will be aware that the recipients of community meals has gone down dramatically, which means that there are people out there being neglected because they're not getting one decent meal a day, and that would seem to be probably for financial reasons.
I think what legislation can assist us greatly with is clarity about what is harm, what is abuse, what are the definitions, and it can assist greatly with that. We absolutely have to also use underpinning legislation matched up with our care standards in every aspect, so that it is quite clear going forward what is abusive and what isn't, and we should stop setting minimum care standards, and we should raise our expectations and look with pride and confidence at excellence in all of our care standards, because neglect is cruel, it is degrading and it's inhuman, and it shouldn't happen.
And
I think
that includes those people that are not getting community meals because they don't reach a criteria that has been risen.
There would
so
be
much to get them outside it.
I think anything at all which means that an older person does not receive the services and support that they are assessed as needing has to be challenged, absolutely. And I would encourage members right round the table to get on smartly with implementing and going out to consultation on legislation on aged goods, facilities and services. It is unacceptable that our older people in particular are experiencing discrimination on the grounds of their age.
Thank you very much.
And I think the definitions is critically important in relation to all of that as well. And just maybe we can go back to that, but the World Health Organization definition that you referred to, I don't know if England, Scotland and Wales use that agreed definition or...
Yes, I mean, that's very much the touchstone for the definition. I think they've all three have got specific definitions of harm and abuse and neglect. But I think it all comes from the... I mean, the World Health Organization, I think the important part there is abuse by someone in a position of trust. And I think that sets the parameters of the legislation. Somebody who you could trust, a professional, or indeed a member of the family, friend, neighbour, whatever.
Okay, thank you. Fergal?
Oh, thank you again, Chair. You were in the room earlier on when I was talking to the officials about this, and you've touched on it now as well. So, this legislation, while it may have a preventative effect, if you like, it's after the fact. And how much is it diminished by the fact that we don't have legislation as you've described in terms of goods, services and facilities? In other words, it's important that people understand they can't do things, but if somebody has the right, and what Kieran's talking about, the right to a service, the right to a facility, then that gives them extra power, or, if you like, in themselves, because the state recognises that right as an individual. So how, if you like, I'm trying to work out, well, this is important, you know, cart and horse here, where does this fit in that scenario?
I think it's interesting that both in Wales and England that the safeguarding and protection provisions are part of broader social care provisions. They're part of the Social Care Act and the Social Services and Wellbeing Act. And I think we have to see it in that context. I think there's the issue of registration and inspection. Certainly in Wales we need to raise our game on that, because it's no good going in and measuring curtains and carpets and saying all is well, because the feel for the home may be pointing towards some concerns. I think in terms of the right to services, yes, absolutely. And I think there becomes a point, or there does come a point, when the state has to assume responsibility for violating the person's human rights. And I think medication, denial of medication was used. There has been litigation on that, certainly in England and Wales. The answers have varied from the courts. The courts always say, well, we recognise there's a resource allocation issue here, but it's having the principled underpinning for these cases that you get from the Human Rights Act, and also, I think, from the general principles you get in the Social Care Act and the Welsh equivalent. I mean, you mentioned earlier on the Equalities Act, which I think is interesting. I don't quite know how to put it, but maybe I'll say it's not all it's cracked up to be. It's good, it's useful, but whether it actually gives a firm enough basis to challenge on the basis, say, of age or disability, the type of case that you envisage is questionable. It's what the courts make of it, I think, is important. But it's there, and I think it's a framework.
And Claire, you've thrown out a challenge to us to lobby, etc. So what work are you doing to promote that and improve it vis-à-vis the 2010 Act?
To improve and promote
on
the aged goods facilities and services. Well, I mean, I don't think I could be very much clearer. We need protection from discrimination on the grounds of age so that our older people are not subject to discrimination and so that they have redress in the event that they are. I don't think I can make it very much clearer. But as an answer to your earlier question, the question of measuring the impact of the lack of that legislation really in terms of abuse. There are so many factors that conspire to create abuse of older people, to tolerate abuse, to prevent interventions and stop protections. I mean, we are a deeply ageist society and we need to place the question of abuse of older people with the same gravity as we do about children. To be absolutely clear, this is unacceptable. It is abuse which is intolerable in our society. And because we diminish older people as a society, we reduce their rights, we regard them as not able, as not somehow worthy of the same levels of protection. And I think that question of equality, redress, protection, prevention are absolutely imperative. And we need to challenge ourselves on our ageist attitudes because too often allegations of abuse of older people get passed off as somehow, well, you know, there are issues to do with carer pressures, there are issues that other people face, and it's difficult, and people, Corley referred to, you know, with professional carers coming in where allegations of theft, for example, are made. There are issues to do with how we care for our older people. Let's put the rights of older people first, and in doing that, let's make sure that any investigation into an allegation is straightforward, honest, open and transparent, so the rights of care workers are protected, so that the matter is investigated quickly and decisively, and they can move on smartly with their reputation intact if that is the right thing, and if not, action is taken quickly. The absence of legislation to protect on the grounds of age, I think, is unmeasurable in terms of the detail, but I think it's an imperative that we have it in place as swiftly as possible.
Yeah. Thank you very much for that fulsome answer. It's exactly the position of our party, and we would also like to see it extended to children to make sure that, but it's locked now in OFM, DFM, and we need to be able to ensure that that gets furthered. Can I ask you, if there's some difference between the board, the department, and you in relation to how we move forward specifically on this? And if I heard them rightly, they would not approve of the idea or support the concept of a safeguarding board specifically. What's your view on that?
I think we should have a safeguarding board on a statutory footing. The current Northern Ireland Adult Safeguarding Partnership is good, it works well, but it is described very often as a coalition of the willing. It does not have a statutory underpinning, and requirement to participate and attend isn't as clear as it should be. There is, of course, the Safeguarding Board for Children, which hasn't been evaluated, as I understand it, but could usefully be evaluated to inform what should go into an adult safeguarding board. But I think on a statutory footing is the way forward without question.
Both Wales and Wales and England have statutory safeguarding boards in their legislation.
Thanks, John.
And can I just return to one specific that I was touching on earlier on? You refer a lot to abuse, and the department is referring to harm as a result of abuse. Now, is there a distinction being made here that I'm maybe right or wrong to focus in on?
Yes, I mean, it's to some extent it's playing with words, I guess. I mean, the basic idea of abuse, and Claire has listed the forms of abuse, and then I think in individual cases one needs to see what the effect that is. And you know, coming back to your point on what is harm, it will vary. It will vary because overbearing treatment, controlling treatment, some may cope with that. For others, it may lead to isolation, which is a form of harm. So I think the key one is abuse is, and physical, psychological, sexual, and the list. Now, has that harmed this particular individual? Has it affected the way they function? Has it affected their physical health, their mental health? And if so, yes, we need to intervene.
Yeah. It's just when I read the sentences, sorry to home in this, but it's just, I think it's worthwhile just to follow. I can remove the word harm, because it says here, for example, promote zero tolerance of harm to all adults from abuse, exploitation or neglect. But you could say promote zero tolerance to adults of abuse, exploitation or neglect.
Yeah.
So I'm just trying to work out what the purpose of using the both words and what, and maybe it's not the right time to interrogate this so deeply, but is there a distinction?
No, I think one is a consequence of the other.
If we didn't have abuse, we wouldn't have harm.
No.
So
Yes, but that's what I'm saying.
Yeah.
Surely if we wanted to strengthen this, we'd simply say zero tolerance to these things.
Well, zero
assuming
tolerance
the
of abuse,
effect
yeah.
that those things have.
Yeah.
I think John and I would be on the same page. It is
Absolutely,
zero
yeah.
tolerance of abuse, which
Yeah,
would be
that is the key message.
Okay, thank you, Chair, thanks.
Thank you for that.
They're not
Joanne, next.
interchangeable, sorry.
Thank you, Chair. Can I apologise for missing the start of your briefing? But what I've heard is quite alarming, and I've just scribbled out neglect, exploitation, age of society. It's good. It's very alarming to hear that. You mentioned in your briefing the introduction of criminal charge for elder abuse. I'd like to hear a wee bit more now. Apologies if you've already covered this. How you feel this would work, and whether you feel. Would the department be supportive? Could you maybe tease that out a bit more for me?
First of all, I suppose to start from the bottom end of your question, if I may, Joanne. I don't know whether the department would be supportive at this point, and the matter should clearly. These recommendations are all going to be part, as I understand it, of the consultation exercise in terms of new policy and guidance. But I think a specific criminal charge of elder abuse would make it very, very, very clear what is meant by abuse, what is meant by harm, what is unacceptable and what is prosecutable. Maybe John can help us.
Yeah. I mean, I'll give you an actual example of a case, a very disturbing case we've had in Wales of the owner, I think, of 8 care homes. There were 110 victims of very serious abuse and neglect. People were vomiting feces because they hadn't been. 60 people died in suspicious circumstances. There was a 5-year police investigation. There was literally a garage load of information and evidence, and the Crime Prosecution Service refused to prosecute because they said there's evidential problems in proving willful neglect. Now, in anybody's book, there are any number of criminal offences there. If you can wriggle out of a criminal offence or criminal prosecution, in that case, we need to clearly define the offence of elder abuse to enable us to capture that sort of. It so happens now that the victims and their families are without any form of justice. So I think that is the type of case that really does underline the importance of being clear that most forms of abuse are criminal offences. And it's interesting we use the term abuse, when in fact we're talking about rape, murder, GBH, assault, and all the other things. Abuse tends to soften it a little bit. You know, I don't know what happens I do know what happens at the age of 60, but something happens. We cease to be victims of a criminal offence, and we are now victims of abuse. It's still a criminal offence.
It is pretty horrific. Sometimes a strong deterrent can be an effective way of reducing abuse. As you had said, the proceedings haven't worked in this situation, even though the evidence appeared to be there. I'm very interested in what you're proposing. How do you see then a charge of corporate neglect working in practice as well?
I mean, corporate neglect is a challenging concept because you're attributing a mindset to an organisation, but it's not beyond the wit and wisdom of draftspeople to come up with an offence of corporate neglect. I mean, if I could go back to this case in Wales, I think you could attribute actually quite easily responsibility on that organisation, that they failed to ensure that proper care was given. They failed to ensure that doctors are called when needed. They failed to hydrate. They failed to feed. And someone, they can't say, well, it wasn't me, it was the other person. There is an organisation that's making money out of this. Large sums of money, and that organisation must have some kind of responsibility. And if it goes to the person in charge, well, fair enough. That's we've done it with banks. We should do it with care homes, because otherwise it'll be somebody else's fault.
I think the other thing I would add to that very clearly in relation to corporate neglect is it's not good enough to blame the individual care worker.
No, it isn't.
It's not good enough to blame the individual in a care setting, which is very often what does happen. It is important that the providers of care services, whether they are statutory or whether they are private, independent, community or voluntary sector organisations, are corporately accountable for the services which they deliver. And that can only be done with a specific criminal charge of corporate neglect and in the context of a specific criminal charge of elder abuse. In the absence of that, there is simply too much wriggle room and no real accountability for the organisations. And I think it would be a very, very decisive and effective move in relation to improving standards.
Yes, there was a wonderful expression in the term in the Stephen Lawrence inquiry about the Metropolitan Police being institutionally racist. Many organisations providing care for older people are institutionally ageist. It's in the DNA of the organisation, and it's about lack of dignity, respect, and going on to cruelty and neglect.
Thank you for your frank answers. Thank you very much. Thanks, Chair.
Okay, Joanne. Michael?
Yeah, thanks very much, and thanks for the presentation, and it's very sobering to hear it. You're clearly looking at the issue, and you've said you need dedicated laws, and you give the examples of England, Scotland and Wales, and you appear to be saying Scotland is the model. Follow?
Not necessarily. Some may argue that Scotland does go too far, and I think we have to bear in mind that we've got to balance, for good human rights reasons, the rights of the alleged victim and the rights also of the alleged perpetrator, because it may not be, and that the person may not be an abuser. Some may argue that Scotland goes too far. Yes, I'm not saying Scotland is necessarily the ideal model, although it is interesting that it has led to more preventative work. We have this range of powers, and we will use them if we have to. I certainly wouldn't go for the English model. I do have reservations about the Welsh model. Perhaps the Scottish model is the nearest to perfection that I can see.
How effective has it been? How long has it been in now, and how effective? Bearing in mind you're looking for proof, you say abusers, primarily family, friends and neighbours. Very hard to get evidence and very hard to prove a case.
Yeah, very hard indeed, because a lot of it goes on, and the figures we have of 3% are gross underestimates of the extent of abuse that does go on. I think that is a problem. I think we only see it in the home when we come across it, and that's a silly thing to say, but I think it's only when there's some kind of intervention through the statutory services that or reports from neighbours that we get to hear about it. I'm not sure what the answer is there. We do need to raise public awareness, because as maybe with domestic abuse, a lot of people just turn their backs and think it doesn't happen.
I'm thinking about Scotland has the legislation. How effective do they think it's been?
Well, I think on the whole, the interesting thing about Scotland, they have the legislation, and the various authorities actually haven't been that good at collecting data.
Right.
The data's a wee bit on the soft side, I think. But as I say, there is, from the report they did from Stirling University, there is evidence that it hasn't been used, the powers haven't actually been used that much. But the threat of the power can be quite a sobering influence on those involved, and can lead to more intervention in terms of extrasocial care. A lot, and we have to recognise that there are some forms of abuse that are the result of carer stress. The carer is totally at their wits' end. They have not had any support, and 24/7 they snap.
Yeah.
And there we can do something in terms of providing support for the carers, recognising their problem. But as I say, a lot of the data on Scotland is soft, but we do know that the powers have not been used as much as some people thought they would be used. We had and I think you have the equivalent here, the old National Assistance Act 1948, where you could remove people living in insanitary conditions, who were aged, infirmed, and all sorts of other unpleasant language. It hadn't been used for about 30 years, but I'd come across it being used as a threat. on many occasions, unless you come along with us, we will use this power. The key thing is we change attitudes, and law can play a role in changing attitudes, and I think we just need to raise awareness of people, both abusers and the general public, that this goes on and we need to stop it.
Could I just pick up on your point, Michael? I think they are quite strong powers. I mean, the idea that you would have a legal power to ban somebody who's a suspected perpetrator from a home, or to access financial records, or a power to remove somebody who's believed to be at risk of abuse. These are strong legal powers, and they must absolutely be tempered with a balance to look at, is it necessary, could anything else have been done? And if they are introduced, and I believe that they should be, but they must not be instead of prevention. They must not be instead of good therapeutic relationships being built with professional staff and people believed to be at risk of abuse. They must not be a bull at a gate. They must not be the first point of call. They are something which I believe should be there as a power in the event that cooperation cannot be obtained and there is strong enough suspicion, information or evidence that the older person is at risk of abuse or being abused, and nothing else will work. But it mustn't be instead of. And I think the pressure on budgets very often means that preventative work is the thing that gets less invested in than does action to protect or to intervene. And I think it's very important to bear that in mind as you're considering it, that prevention very often doesn't come up on the statistics as clearly as actions taken to protect. But it is absolutely imperative that we respect and value good community work, good social work, good psychiatric work, good engagement with older people who may be vulnerable, and indeed assist them to come to a conclusion themselves about what is best in their circumstances, as well as having the power to intervene, remove the perpetrator, alleged perpetrator, or the person deemed to be at risk in the event that there is such a degree of vulnerability that nothing else can be used effectively.
The point is, if you decide you need it and this is going to work, yeah, you can go bespoke. We'll be at this for a long, long time. Whereas if you have something and you can see clearly it's working in Scotland, you take it off the shelf, dust it down, go to consultation, and you can legislate.
And I think a very critical part of the Scottish legislation are these general principles, one of which is along the lines of the least restrictive intervention. You must always, and those are statutory principles. You can go back and you can argue those that it's got to be the least restrictive. And I think I would certainly, if you go down the route of legislation, it's important to have those principles in place.
Thank you. Paula?
Thank you, and thank you. As Michael had said, this certainly is sobering, and what I find even more powerful about this whole debate we're having today are the amount of people who are sitting in their homes day and daily that have no contact with social services or anybody else because they haven't needed contact for various reasons and are being abused every day, 24/7, by either their family members or by people that they have been groomed by and have come to trust. And I think that is something that needs to be addressed. And I very much welcome the raising awareness. And Gordon brought this up earlier in the last presentation. I mean, whenever we talk about child abuse, domestic violence, we have so many awareness measures out there in the public to try and say to people, if this is happening to you, this is what you can do, or this is who you can call. And, you know, and even as Joanna said, some of the words there that were being used are the same words that I heard only 2 days ago in another meeting. I chair the Sexual Health Committee, and we had Brooke in, who were talking about children and child sex exploitation. They were all to do with power, control, vulnerability, and this is happening day and daily in our country. And let's not kid ourselves, it's happening in our streets where we live, where elder abuse is taking place. So how would this legislation legislate with those people that are at home that haven't got all of those other people involved in their life? I mean, some of the people that are involved in social services and other agencies, I would say a lot of them are the lucky ones because they have got outside agencies coming in. There are people at home today who might see a bit of this in the news at some stage and think, that's me. That's what's happening to me every day. I'm being abused no matter what way, because every one of them are bad, you know, and they are bad. They're not abuse, and as you say, shouldn't be called abuse. They should be called GBH, ABH, attempted murder, rape, depravity, all of those things. And that's the hard line. That's what we should be calling them, because that's what we call them when we look at other age groups.
Absolutely.
I think that the question that you raise is a very important one. The awareness of abuse and what is abuse and what can be done in the general public. I mean, I've been out with Women's Aid a number of times, and what a lot of older women who've experienced abuse say is, well, I didn't think those posters referred to me. I thought that was about like young married women with kids. I didn't think it meant just being given the silent treatment, or just not being talked to, or him just keeping the money. I didn't think it meant me. I didn't think it meant me. Hear that again and again and again. An awareness both of your rights as an individual and of what abuse is and isn't, I think, is very important, and we aren't sufficiently clear about it in the public arena. You ask around the population, well, what is abuse against older people? You will get quite a lot of quite puzzled looks about what it actually is and what it actually isn't. So I think clarity and awareness is very important. You also raised the question of long before people are in need of domiciliary care or residential care or those sorts of services. What kind of community support is out there? Invest in our community organisations, in our good community infrastructure, so that older people can continue to go to their social clubs. They can go out to events and activities where they remain engaged, where they remain in contact with people that they know and trust, and aren't forced into that position of isolation. Good community organisations which will come and collect you at your door and bring you to the activity. Those sorts of things are too often not seen as cost effective and can't measure terribly easily the preventative impact they have. They're absolutely critical in keeping older people connected long before they need that kind of social care. So thank you for raising that. But I think it is also important to look at awareness not only of what abuse is, but what happens when you report. I hear quite a lot of anxiety as well about, well, if I tell somebody that I'm worried about this, what is it that's going to happen? And in the main, my understanding is that people have absolutely no idea what happens if you make an allegation of abuse against an older person. And I think we need to be very transparent about what does happen, whether that's an allegation about a care worker, a family member or anybody else. Because I think even around this table, with respect, I think there'll probably be a variety of levels of understanding about what happens, because it isn't as clear as it should be.
And something else I feel as well is a great sadness, and it is a sadness. I mean, every day we hear of different stories that come out of people who have been abused, whether that's been institutional abuse or whether that's been abuse in their own home by people that they, you know, trusted in and everything else. And we hear it 20 years down the line, 40 years down the line, 50 years down the line. Here we have a section of people that we may never hear because they haven't got 20 years, 40 years, 50 years down the line. And that is so sad that this whole section of our community are being, you know, are not being given that outlet to say, this is happening to me, I need help, I need someone to help me.
You certainly raise a lot of points there, and I think we do need, I think the time for soft peddling on a public awareness campaign is gone.
Absolutely.
I think it needs to be a pretty hard-hitting, almost kind of the NSPCC full stop approach, that people need to be shocked into thinking that this does happen. I think also it's important to consider the definition of adult at risk. And one concern I do have is that we link it too much to people who need social care services. I think it needs to be liberated from that. There are actually millionaire older people who are being abused. And you know,
as there are wives, as husbands,
indeed,
and children.
Absolutely, yeah. And I think we need to be aware. I think that's an issue that is a resource issue, and that's the argument that comes back. But that's something that needs to be thought about quite a lot in any future legislation.
And I think that is also part of the preventative and the protection that we need to raise this. We need to raise the bar and make this, you know, abuse is abuse is abuse, no matter what age you are, what sex you are. You know, abuse is abuse.
I think so, and it does come back as well. I mean, the colleagues around the table have raised the question, for example, of carer stress. Carers can get very stressed. It can be very difficult. It is absolutely no excuse whatsoever for abuse, and it is no excuse for the state, the fact that there are carers present, family carers present, it is no excuse whatsoever for the state to step away from its responsibilities too. And we do need much, much better support for older carers. Absolute certainty that when their carer needs are assessed, they are met in full without question in a way that is flexible and meets their needs, to enable them to continue to care for their relative or loved one in a way that allows them to lead dignified and fulfilled lives. There is all parts of the same joined up process: early intervention, better respect for older people, less ageist attitudes, equality in terms of goods, facilities and services, better support for carers, and please, decisive intervention when somebody is being abused. It's not leave it, let's not wait, let's not leave it till later, hope it goes away. As you say, older people don't have so long in front of them, and they deserve to live their later years not being vulnerable, exploited, bullied, intimidated and assaulted.
Thank you for that. Gordon?
Thanks, Chair, and thanks very much for your presentation, both of you. I had mentioned earlier about the institutional abuse, and I think we're all sharing the shock and the horror of how much of it has been discovered and how it was allowed to go on. And I think we all need to get an assurance that we will not see a repeat of this over the forthcoming years. So what sort of procedures need to be put in place to ensure that such doesn't happen again? Is it down to the RQAA, who we hear so much about, especially within this committee? I've actually met some of the RQAA representatives recently here within Stormont and was impressed by what they're doing, but I don't feel they have the resources in place. They perhaps don't have all the necessary skills to manage all of the various institutions. And outside of the institutions, it has been covered earlier in relation to individuals. So how can we get an assurance that the systems that are going to be in place, that we get an assurance that there is compliance with healthcare standards?
So it's a significant question, Gordon, and warrants a kind of a longer investigation. But in principle, what I would say is our standards of care, whether that's domiciliary, residential, nursing or other care, need to be aspirational. They need to be high standards. They need not to be things called minimum standards. The regulation and inspection needs to look at the lived experience of people who live in that facility or receive services, how they experience it. Are they treated with dignity and respect? Does it assist and support them to lead full, dignified and engaged lives, as well as all the kind of more matter-of-fact matters to do with medicine management and cleanliness and so on, but what it's actually like for the older person. And we do need to see decisive actions, whether that is prosecutions for corporate neglect or whether it is deregistration of owners who are unfit, whether it is action against individual care workers or improvement plans. Those must be decisive and followed through, and whistleblowers must be better protected, because without that, you will have seen the report, I'm sure, the independent review of the situation in a home in Carrickfergus called Cherry Tree House. Yeah. And certainly there are a couple of lines in that report which indicate that for 8 years that home failed to even meet the minimum standards. Now I find that deeply shocking.
Yet they were highlighted.
That in spite of...
have been raised.
They have, but in spite of whistleblowers, in spite of families raising issues, and in spite of care workers, members of the public raising issues, and in spite of it being investigated and looked at by a number of bodies over time, for 8 years that home failed to meet the minimum standards. I do find that very shocking, and I imagine that a large number of older people lived out their entire end of life in a care setting which failed to even meet minimum standards. We do need more decisive action, and we do need to be very clear about what we expect.
We need to be firm on regulation.
I think also you need to, if it is the same as in England and Wales, it's about professionalising the workforce. It's a casual workforce, it's poorly paid, there is minimal investment in training, you're taught how to feed, clean, and that's it. You're not taught anything about treating people with dignity, and the person may be there for a month and move on to something else, and I think that's not an appropriate level of professional input.
That's a considerable risk you've identified there, that needs addressed.
Yeah, it is about decasualising and professionalising the workforce, because it's a crucial job they do.
I think John's absolutely right. It is about improved status, respect and investment in the workforce. The workforce, they do an incredible job, a lot of care workers, incredibly good job. They deliver dedication, commitment, hard work, and real care and love for a lot of the older people that they care for and provide that care for. And I think they deserve better support. They deserve to be properly paid, properly trained, properly supported. And they also deserve to be challenged when things go wrong, as do their managers, as do the owners of businesses, because our older people are the group of people in that setting who are least able to speak up for themselves.
And do you feel, finally, that there needs to be an emphasis on audit and review within organisations, within institutions, to give assurance to the public that the businesses and the organisations are working to the standards and providing the level of care that they say that they do? A lot of things are found out by audit and by review. When people when someone independently goes in, walks into an organisation or institution, why do we wait until something happens? It should be done on an ongoing basis and given feedback to the management and those in authority, rather than waiting until an event happens, as we've been all told about through the sad cases in institution. Why is it not being done on a planned, progressive basis and given assurance that to everyone, those that are in there, their families and the general public, that what has been done is actually being done and that they're working in compliance with procedures?
But I think, as Claire says, it's not necessarily all about measuring the infrastructure. It's about measuring quality, the experience for older people. And, I think across the UK we need to rethink the way in which we assess the quality of care that people are given. And one thing we need to factor into it is dignity.
Correct.
Dignity, and it's a word we
how do you measure it? How do you measure it?
Well, how do you measure it? Yeah, interesting. I mean, you might not be able to measure it in a scientific way before you can feel it when you're in there.
Correct.
You know a good care home when you go in one. You know a bad one too.
And you smell it?
Even though it's absolutely, yeah.
It is a very interesting question, Gordon, as to what extent we look at things like audit and overall assessment. There are individual reviews. You can go onto the RQIA's website and see the inspection reports of any registered facility. But it would be useful to have overall a sense of, is there a rating system for care homes, for example, that we can have in place, something which rates it? Is there absolute certainty that if issues are raised at one inspection or by a whistleblower or through complaints at some point, that they are automatically revisited at the next inspection? And some overall sense of how well is our care sector doing overall?
Some measures.
Some measures, because I think we underestimate the extent of good care and we don't act decisively and quickly enough sometimes in the event of poor care. And I think both of those would create more confidence in the sector.
And what do residents think?
Correct. Thanks very much.
Okay, thank you, Gordon. Now, I'm conscious, Professor Williams, of time, and there's 3 more speakers. Are you okay at this point if we... Okay, so we'll be as concise as we can, because I know you have a flight to get. So I have Rosie, Pam and George. Rosie.
Margaret Cafferly. If I could just say that the issues and questions I was going to ask have been covered, so I appreciate the presentation and I think it's a really valuable discussion, so I'll not take up any more time.
Thank you, Rosie, for that. Pam.
Thank you, Chair, and thank you very much. A very good presentation. Thank you for being so clear and concise, both of you, on all the issues. I first was presented with elder abuse in the context of domestic violence and abuse by Women's Aid in my first initial years as a counsellor in Antrim. And I heard many stories that day in that first presentation, and one was of an 80-year-old woman in a home with her husband sharing a double room. She had dementia, he was just frail, elderly, and the wife was having, they discovered bruises that they could understand where they were coming from, and when it was raised then with the GP who came in to see, and the answer was, oh yes, there's a 60-year history of abuse with this couple. And the reaction was to remove the wife and put her in a single room, and they didn't even they made up an excuse as to why she had been moved, because she was disturbing the husband's sleep, to move her out. What my question is to you, John, you talk about the legislation and the maximum level of and extreme legislation in Scotland. Would that have safeguarded that lady? Would that have led to her being,
Yeah, I mean, one of the disturbing things in what you say is that had been going on for so many years and hadn't actually been addressed. Yes, I mean, there are things that could have been done. I mean, you could think of the assessment order, which I think might have been useful. The removal order might have been useful. The banning order might have been useful. Clearly, there are sensitivities in each case that you need to address. I mean, I think it's interesting that when you reach whatever age it is older age, we don't think of it anymore as domestic abuse or domestic violence. And I think one of the challenges we're having in Wales is we're talking about legislation for domestic abuse. We're talking about the safeguarding legislation, but we're not talking to each other because there are clear overlaps. And the other example I come across more and more now, where, say, it's been an abusive relationship throughout the marriage, where maybe he is abusing her, he suddenly becomes vulnerable and frail. He gets Alzheimer's, and it turns round. And that's a very difficult one to deal with. But I think the simple answer to your question, yes, there would be a power of entry, which may be helpful. There could be assessments. But also, what support can we give her? What support can we give him, maybe? I don't know. And it's all part of this total package, not only of the safeguarding, but the type of care, the quality of care that we can provide people in that situation. But I say the really disturbing thing is that there has been a long history of abuse.
And Claire, just on the same scenario, what was also said at the time was actually, yes, we know that there's a 60-year history of abuse with this couple, but it was known by not just the GP, but it was known by the family. And obviously not dealt with in any way. And you've mentioned several times in your presentation the fact that, that this is happening, by people, the perpetrators are people that we know very often, family members, carers. How badly do we need, a new campaign to raise awareness and to make it socially unacceptable, and just to reiterate how unacceptable it should be and must be. And given the kind of figures we heard about from the Department of Health, talking about 7,500 referrals as a result of Kieran's question to social services, which was a 36% increase in the previous year, and your own estimate of stats that it should be much more, if we had a very successful campaign, would we actually be able to cope with the fallout of that kind of campaign?
I think that's an interesting question, Paul. It has to be the case that it does. If we raise awareness, which we have to do, you have to have in place.
I'm going to thank you, because I know you have to leave. And
my apologies.
Apologies, John, but maybe you could direct your question to Claire. Are you okay to stay for a few minutes? Yeah. Thank you very much, Professor Williams.
Thank you very much.
Appreciate it, and we will continue the conversation as the policies develop. But certainly, as Chair, it'd be my view that it needs to be underpinned by some sort of legislative framework. But thank you for taking the time.
Very interesting
If I could extend my thanks to Professor Williams as well. He's been enormously helpful, and he is an internationally credible, renowned expert on elder abuse, and his time has been absolutely invaluable to me and to colleagues here.
Thank you.
Thank you.
Thank you.
George, did you want to maybe direct your question to Claire, who's kindly agreed to take a few minutes to do that?
Just like to thank Claire for her presentation. A couple of questions. First
I'm sorry, George, I'm having trouble hearing you with the rustling.
More an observation, basically. I was part of the team in OFMD-FM that set up the historical abuse inquiry, and we've seen the outworkings of that at the present time, and it's really horrific when you you know, when you hear some of the stories that are coming out of the inquiry at the present time. But moving on from that, one area that I feel that we need to take more, I have been lobbied by several relatives who's maybe people, or elderly people, very elderly people in hospital, where on occasions had to sort of step in and speak to the management, where there was clear cases of neglect towards their elderly relative. Somebody who's very elderly and nearly ended up in discrimination cases, you know, where they was shunned, left to the one side, and maybe they wet themselves and been left there for quite a long time. You know, occasions like that there, and I think that's one area that needs, I'm not saying for 1 minute that all medical staff or all hospitals, but there is the odd isolated occasion where we need to be keeping a, you know, a sort of a closer watch, particularly from very elderly people's point of view.
Without question, I mean, Professor Williams did refer to it, we are institutionally ageist.
Yes.
And I think older people do get set aside too easily, they do get disregarded too easily, and their concerns and their anxieties and their fears and neglect of them is set aside too easily. And we do need to step that up to make sure that both older people's rights to proper, fair and decent treatment is always actioned, but also that we set aspirational standards for care and for treatment, that we invest properly in what looks like really, really excellent care services, excellent hospital treatment. What is it an older person with dementia needs when they are admitted to hospital and they're already confused and they've had a fall and they've waited a long time in A&E and they're on a medical assessment unit or a ward and they're confused? They're not being a nuisance if they're crying out for help. They're not being a nuisance if they need assistance to go to the toilet. They have distinct needs and they must be regarded as people with enhanced and additional needs to which they have the right to have those met, rather than something which is a trouble.
Yes, that's my point. I think they need more closely scrutinised, you know, for
And we need to look at what
in regard to the medical problem that they do have.
Absolutely. What is the level of staffing that's required on hospital wards? What do people with dementia really need? What do frail older people who are waiting in accident and emergency need by way of assistance and support? And let's put it in place with pride and confidence. I would encourage you to say, invest confidently and proudly in what it is older people need. So we can look around us and say, it's not that there's quite a lot of good care and some that isn't, but that we always have excellence in care. And when that falls short, because things can always go wrong, we deal with it swiftly and decisively.
My point is that they're really discriminated against because of their, you know, because of their age. Sort of pushed to the one side, just neglected.
Indeed.
Okay. Well, Claire, can I thank you and Professor Williams? I think it's been an extremely useful discussion today. Obviously, as a committee, we will be tracking the consultation around the policy, particularly, I think, in relation to question 28, which is specifically around the need for legislation and reflecting on the responses coming there. As I said, it's certainly my view, and it's been enforced today, I think, around the need to have the legislative framework and the opportunity for, if you like, the North to lead the way in relation to this and get the right fit. So I want to thank you. It's been very informative today and look forward to that continuing engagement around it. Thank you.
Thank you very much, and thank you, Chair. And again, my thanks to Professor Williams and colleagues around the table. If I can be any further assistance, please do ask. This is a matter on which we have a relatively small population here. We have the opportunity to be decisive and to really show some considerable leadership in terms of preventing and protecting our older people, and we need to do it. So
thank you very much for
your time.
Thank you for your time. Okay, members, moving on to item 6, which is the proposed amendments to the Safeguarding Board. I want to refer members to page 118 of the meeting folder, which is the relevant papers. Just advising members that departmental officials and the chair of the Safeguarding Board are here today. And to give further evidence on the proposed amendments to the Safeguarding Board regulations. The folks are en route. Okay, it is much. You're back again, busy day with the committee. Very welcome. And we have Miss Donna Ruddy, Head of Child Protection at the department, and Hugh Connor, Chair of the Safeguarding Board. You're very welcome, the three of you. So I'm going to ask you to give the presentation and we'll open it up to members' comments or questions. I just want to, before I start, Hugh, I'm mindful that we have received an email today directly from the Safeguarding Board this afternoon, and I want to advise yourself, Mr. Connor, that we fully understand as a committee that there's PSNI investigations ongoing, and that criminal prosecutions may or may not be taken. Therefore, we intend that our questions won't touch on those issues. However, we do want to say to you that if you feel that our questions are anyway straying into that remit, that you're quite within your remit to ask us to bring that to our attention, and we can consider what action to take in and around that. So I just want to reiterate that point, that we're very mindful that there's ongoing investigations. So I'm going to ask at this point if you want to add anything, given that the email was sent, or comment anyway.
Thank you, Chair. Thank you for that sentiment. I mean, obviously my intention in actually drawing this to the committee's attention was that clearly it is necessary for you to receive information. Some of the information there, I think, has the potential, if developed further, to be A, confidential, B, maybe have some impact upon the review, and C, maybe some distress for the individuals themselves. I just wanted to draw that to the committee's attention, and thank you very much for those sentiments.
Okay, thank you for that then. Okay.
Thank you, Chair. Members are aware that the Department is seeking the agreement with the Committee to amend the Safeguarding Board for Northern Ireland Membership Procedure Functions and Committee Regulations of 2012 for the purpose of changing current quorum requirements and to add a designated doctor to the membership of the SBNI. The Department has reflected on the evidence given to the Committee and subsequent comments from committee members at both the 10th and 17th of September sessions, and provided an options paper for your consideration. I would like to begin by stating that the current quorum arrangements for the SBNI are presenting some difficulties in practice. While the SBNI is reporting 70% attendance on average at meetings of the Board, the last two meetings of the Board, for example, have not been quorate because more than two-thirds of the membership, the current quorum requirement, were not in attendance. The quorum difficulties have become accentuated by, and I mean this is a significant point, not caused by the ongoing thematic review, which will potentially encounter quorum difficulties because of declarations of interest in matters either under discussion or for decision which relate to the review. I should emphasise that quorum difficulties linked to the thematic review caused by numbers declaring an interest are expected to be infrequent. There have been no quorum problems generated by the thematic review to date during a period of almost 10 months. In the main, the key difficulty will be the signing off of the review report. It has already been agreed that those members of the SBNI with an interest in any of the 22 cases under review will have no role in approving the final report before its submission to the Minister. They will be given sight of the report for factual accuracy checking only, prior to it being signed off by those members of the Board who have no prior connection with any of the 22 cases. It would appear that the proposal to reduce the quorum requirements significantly and the link made by the Department between quorum and the ongoing thematic review have led to questions over the independence of the review. Consequently, the Committee asked for an options paper from the Department, and this paper is included in your papers for today. The options paper presents three possible quorum options and identifies a preferred option. It also sets out in some detail the measures put in place by the Chair of the SBNI to ensure that the thematic review is undertaken in a way which is robustly independent and is seen to be so. I do not intend to restate what those measures are, but the Chair of the SBNI, Hugh Connor, is here today to answer questions members might have about how the thematic review is being conducted. If I can turn to the options for dealing with the quorum difficulties, members are aware that the regulations governing the SBNI currently require more than two-thirds of the membership to be present to enable the SBNI to transact any business. It is clear that the initial policy decision to set attendance levels and the seniority of members high is proving difficult in practice. It is also clear that if we're going to continue to require high levels of attendance by member organisations, then a system of deputisation will need to be introduced. This was a recommendation of the SBNI in its response to consultation on the original proposal to reduce the quorum to 1/3 of SBNI members. While the method of deputisation suggested by the SBNI is attractive, we have been advised by lawyers that we don't have the primary legislative powers to introduce a system of deputisation in that way. However, it is possible to introduce deputies by way of an amendment to Regulation 3 of the SBNI regulations. This will involve naming the deputy alongside the post holder already named in the regulations. For example, an assistant director in the Health and Social Care Board alongside the director, or a chief superintendent of the PSNI alongside an assistant chief constable. We've identified 3 quorum options, including the 1/3 option consulted on previously, which we fully acknowledge did not have the support of the SBNI and was rejected by the committee. It is also not in keeping with the original policy intention of securing attendance by senior representatives of member organisations in large numbers. However, without support for a system of deputisation or an arrangement which permits a different quorum calculation to take account of declarations of interest, it may be the only viable option. Also, it is in keeping with accepted quorum practice in other HSE bodies and the practice of a number of local safeguarding children's boards in England and Wales. The second option is that suggested by the SBNI in its consultation response, that is, that the quorum should be set at 51% of the membership, and under this option the SBNI would require that 15-member organisations attend meetings of the board. Also, in relation to voting rights, which are impacted by declarations of interest, the SBNI recommendation is that quorum should be calculated on the basis of 51% of the total board membership, minus any agency or member declaring an interest. Under this arrangement, the resulting figure will fluctuate depending on the number to attend and the number to declare an interest. In practice, it could mean that the SBNI could proceed with business with as few as 8 members with voting rights. If this option is adopted, we would not support a system of deputisation, as the level of quorum should permit the SBNI to function without any degree of compromise. We also have some concerns that this option confuses quorum with majority decision-making. And paragraph 6 of Schedule 1 to the regulations already requires every decision at a meeting to be determined by the majority of votes of the members present, that is 51% or more of the votes cast. The third option is the preferred option. This approach was suggested by the committee at the evidence session on the 10th of September. And under this option, the existing quorum requirement of 2/3 would be retained and would be supported by amendments to Regulation 3 to enable deputising to take place, better facilitating attendance at board meetings by member organisations. In addition, it is proposed to introduce a second supporting quorum arrangement, which would apply only where more than 1/3 of the total membership of the SBNI, that is 10 members, declare an interest. And in these circumstances, the quorum requirement would be 2/3 of the remaining members. Under this arrangement, we propose to permit deputising and would amend Regulation 3 accordingly. Deputisation will maximise attendance, making a general quorum requirement of 2/3 deliverable in practice and is in keeping with original policy intention. This proposal is similar to that suggested by the SBNI at option 2. However, the SBNI proposal would permit a reduced quorum requirement when any number of the members declare an interest. Under this option, exceptional circumstances, measured by an unusually large number of members declaring an interest, must apply before the different quorum formula can be employed. This is likely to be the case when the thematic review report comes before the SBNI for approval. The workability of the 2/3 formula in exceptional circumstances will require good attendance by SBNI members in the first place, which, as I've said, will be facilitated by deputisation. Again, this is in keeping with the original policy intention. This option has the support of the SBNI and would apply to meetings of the SBNI and its statutory subcommittees, that is, safeguarding panels and the case management review panel. That brings me to the end of my presentation. It summarises what is contained in the options paper, and I'll now hand over to the Chair of the SBNI, who wants to deal with matters specifically relating to the ongoing thematic review, and then we'll take questions afterwards. Chair, thank you.
I just want to make a couple of comments, if I may, Chair. Basically, you will all know that the Minister issued his direction to the Safeguarding Board in relation to this matter in December 13. I think one of the things I want to stress to the committee is that whilst we work on this and talk a lot about this, we're doing lots of other things in the general and broader field of child sexual exploitation. And I think it's really important that the committee is aware of this, albeit that I know we're likely to concentrate this afternoon on the thematic review. Eilish has actually highlighted what were the Safeguarding Board's concerns in relation to the quoracy issue. Certainly our favourite option was to retain a high level of quoracy of 2/3 and to move to some deputisation. Our second favourite option, if that were not possible, was actually to move to a 51% for our figure, because we believe that symbolically and in reality it's important that the board does have senior and high levels of representation. So I really will probably not, unless you ask me, I will probably not make any more comments about quoracy. The main reason I suspect why I was asked to attend was to contribute to any discussion about basically the ongoing investigation. And I do so to explain and answer any question that members might have in relation to the comments or statements that we discussed a few weeks ago. Clearly, the role and function that I've had, I believe, has been to take the ministerial direction with the powers that it conveyed, and in so doing, to produce a proper and thorough and comprehensive review, a learning document that basically will assist the service, but also to do this in a lawful way, which basically means that in terms, there are some impediments, and one of the impediments is clearly the comments made about the compromising, interfering and undermining police investigation. And the second is actually the overarching legislation, and in particular some of the sections of the Data Protection Act which have an impact upon how far the board is able to actually act in that. And I'm quite happy, and the reason for being here is actually to make sure that the committee understood what are the issues, to answer any questions, and if there are things that I haven't considered, to actually sort of take those away and reconsider them.
Thank you for that, Hugh. Okay, I suppose specifically, Eilish, maybe just directed to yourself initially, from the department's point of view, is, in your view, the Safeguarding Board the most effective vehicle for the thematic review?
We continue to have confidence in the thematic review, and some of that confidence is drawn from how the chair of the SBNI has actually set up the thematic review. And in your paper, I mean, I've set out very clearly some of the mechanisms that have actually been put in place to create what we would call a firewall between the conduct of the review and the membership of the SBNI. I think the chair has to be commended for the efforts that he has given to actually ensuring that the review is sufficiently independent, and more importantly is seen to be independent.
But the obstacles, despite the conflict of interest issues, which are obviously clearly issues, but the issues around data protection, the issues around criminal proceedings, the issues around over 18s, still stand if the quorum is reduced in any shape, form or fashion.
I think what they demonstrate is that this is a complex exercise. I mean, it is complex by virtue of the fact that it involves 22 very vulnerable young people. Also made complex by the fact that we have an ongoing police investigation. Now, in my view, none of those things are going to go away, regardless of how we undertake a review of those cases, and that includes a review by way of a statutory inquiry, or as the suggestion the last time around was passing responsibility for this exercise to the Kathleen Marshall inquiry. So we have complex issues involved in this review. My view is they are not going to go away if we decide that this is going to be undertaken in a different way.
But I'm going to ask you specifically then, if this was an inquiry set up under the Public Inquiries Act, how would that assist the process?
I still think you have to take account of an ongoing police investigation, and while there's nothing that prevents a statutory inquiry from happening alongside other proceedings taking place, and that includes criminal proceedings. I mean, there are actually powers within the Inquiries Act to suspend an inquiry pending a determination by a criminal.
But, okay, sorry, no, I mean, absolutely, of course, if there's criminal proceedings and they have to be taken into account, of course, I don't think anybody's disputing that, but specifically around the issues around data protection and the powers that would go with that, and the powers that would come under a Public Inquiry Act.
I mean, I think we need to go back to what we're trying to do here also. This is intended to be a learning exercise. We want to learn from how 22 cases were actually handled by a range of agencies that had involvement with those cases. The SBNI has powers to do that. It has statutory powers to review those 22 cases. You take this somewhere else, it probably will take longer to deliver. It will certainly be more costly to deliver. Will it deliver anything different from what the SBNI will deliver? I'm not certain on that particular point, but it will certainly deliver it more slowly than the SBNI will.
But I think with respect, it's a wee bit more than just a learning experience or learning from these processes, because we could reflect back to 2009 and the piece of work that we had from Bernardo's, which clearly flagged up the issue of child sexual exploitation, and more than that, actually mandated organisations and departments to do certain things. So, you know, whilst this is a complex issue, and there is always learning, there is equally a need to have accountability and to ensure that we do all within our power to stop this happening. So it's a bit more than simply learning from this issue, you know, and I think if we have gathered anything from the English example, it has been about the need to have those accountability mechanisms in place, the independent nature. And, you know, I listened carefully to the professor who came over from the Rotherham experience recently, who just talked about a collective failure. A collective failure across systems, across agencies, across departments. And, you know, this needs to be got right. Clearly needs to be got right. And I think, my view is that, and I'm going to look to Hugh on this, that even reducing the quorum or looking at this hybrid model that we're referring to, we still have the obstacles that were flagged up a number of weeks at committee from the department and from the Safeguarding Board. The obstacles around not only the conflicts of interest, but the criminal proceedings, the over 18s and the data protection.
May I say, yes, Chairman, I mean, in many ways I readily understand the difficulties that the committee have, because it's justice being seen to be done and things being seen to be transparent. There are three different groupings here, Chairman. Firstly, I vividly recall the discussion in the, probably around this table, certainly in the House, probably a year ago, when you were discussing this particular issue, and there was a real concern at that time expressed by MLS. Basically, the process would be seen to be fair. Now, the costs that are being incurred in relation to this review are all my attempt to actually put in place a process that would be seen to be fair. And what we have is a sizable number of the cases where the process will be totally transparent. All of the information of the relevant agencies will be made available. It will be independently scrutinised. It will come back through a process that will be independently quality assured. And I think I can offer you a reassurance about that. At the other end, we have a number of cases that basically it is unlikely that we will be able to make any commentary on, and we were probably always going to be unlikely to make any commentary on this, and I suspect any inquiry was unlikely to make any commentary on this because this review was actually running simultaneously with a criminal investigation, and the criminal investigation was likely always to trump our review. And then we have a third group, which I referred, Chair, the last time to you, and that was a small group of cases where there were concerns about the welfare rights of these individuals. And again, I know the committee, and certainly the SBNI itself, has always had a view that what we wanted to do was to be conscious of the rights of the 22 young people, along at the same time as we actually sought to learn the lessons for a wider population. With regard to this particular group, judgments are being made that it would not be in the best interests, and the reasons for that, the reason why judgments are being made in that regard is because of the potential harm or distress that would be caused and its implications for data protection. Now, what I am seeking to do, Chair, is to actually work with those organisations, not to have an independent review of those files, because it is out with my power to do that. It is out with my power to do that, but rather to actually conduct with those organisations a desktop review of those cases so that the learning in each of those cases will be incorporated into the report. That, I think, in the context, is the most that the Safeguarding Board can currently do to try and fulfil its responsibilities to the committee and to the Minister in terms of this matter. I think that we will produce a report that will be an honest review. I think it will have lessons in learning for the system and will identify shortcomings. I suspect that that report, when it is available, is possibly, this is my personal view, but I suspect that's the time when the committee may well decide whether, in fact, there were big gaps in this particular process. Because I would suggest that we're so far down the process now that it would be wise to allow the process to continue and actually learn what lessons we have.
But I think, you know, with respect,
yes,
I am listening to this word learning, and the whole process or remit around the thematic review was to make a judgment, was to actually make a judgment on how effective these organisations were in safeguarding the 22 children in care.
That was certainly one of the four major areas of responsibility we were given.
I would suggest a main plank.
Yes, yes, I wouldn't argue with that.
So it's much, much more than simply learning.
It is certainly, we're required to actually answer 4 questions on behalf of the Minister, and we will be addressing those questions in the report. And that will include how effectively organisations work together to protect those children.
But, okay, but you know the point that I'm getting to.
Yes,
Too many of those organisations that are now sitting on your board have a direct conflict of interest. So how effectively are you, which it seems to me, you know, that there's been almost this shift on focus to learning as opposed to actually making a judgment, which was what we set out to do. But I'm going to move on, and we can come back to this because there's a number of people have indicated. Fergal first.
Thank you very much. I mean, there's a lot of issues here. Clearly, you've taken away from our last committee and come back with another proposal. Can you express yourself content as much as you can with that proposal, consistent with?
In relation to quality, I would be content. I am content.
But the last time that you gave evidence to us, you said you were against the diminution of quorum in the way that it had been proposed.
Well, I think the proposal that the Department are bringing is related to deputisation, retaining the quoracy at the 66% level, but allowing those senior staff to actually nominate senior deputies, dedicated deputies, and in so doing to retain the 66% quoracy, and that was our original recommendation. So I would be content.
In our last discussion as well, we talked about perception.
Yes.
And, I'm sorry, it may draw this back to the original announcement of this between the inquiry and your process. And there were questions being asked at that time about why the Bernardo's report's recommendations had not been implemented and who was going to ask the hard questions about that. And now we're hearing that a lot of it is about learning. And isn't this the soft end, if you like, of what the original problems were in relation to this? And that even with some of the deputisation issues here, the perception will be that you've been mending this cart as it goes along the road in terms of trying to get an outcome so that you can get a result, if you like, and get the inquiry finished.
If you're addressing that question...
I'm addressing generally.
The Chair's already made reference to the Rotherham inquiry, and we did have Alexis Jay who undertook that inquiry on behalf of the Council. We had her across at the end of September, and the Chair and others actually attended that. In my mind, there is no significant difference in the way the SBNI review is being undertaken and the way that the Rotherham inquiry was undertaken, led by Professor Jay. And one of the points that Professor Jay made on the 30th of September when she was across here was that the inquiry exercise was to identify learning, what needed to be done to make things better for young people in the future. But where individuals needed to be held to account, there were separate processes for doing that. No different to what is being done by way of the thematic review, because if, as part of that review, individuals are found to be wanting, then processes for dealing with them in those circumstances would then be called upon. And I'm thinking about disciplinary procedures or processes, for example. But I do come back to the key point that the primary point of this exercise was to learn from how those 22 cases had been handled for the purpose of putting in place different arrangements, if that's what's necessary, to ensure as far as possible that it doesn't happen again.
But would you agree that you haven't been able to interrogate those 22 cases to their full extent as a result of the process you've embarked upon?
I accept that that is the case, and Hugh has explained why that is the case. But I will make the point again that I'm not convinced that doing this in another way will actually overcome that particular issue for the reasons that we've stated.
Yes, but you've got an inquiry on one side that doesn't have proper powers and another inquiry on the other side that doesn't have the power. Well, notwithstanding the reasons that you're giving for that doesn't have the power to interrogate. And we've ended up with, and we don't have a figure, you illustrated that it would be less than 22. I don't know if it's 2 that you're investigating or 10. But we don't know. And that's the process that you chose. And now you're saying the flawed process that you chose may not produce another outcome against any other process. That remains untested.
I think we can say that it isn't 2 or anything like 2 without disclosing a number at all. It certainly isn't 2 or anything like it. So, in my view, given the numbers of cases that will be reviewed as part of this exercise, there will be significant learning from that. And while there may be other cases that are subject to an ongoing police investigation, that police investigation will come to an end at a point in time, and it's at that point that this exercise can be revisited for those remaining cases. So we've got a significant number, and I am using the word deliberately, we do have a significant number of cases being reviewed at the minute, and that has the potential to be added to when the ongoing police investigation concludes.
And what would be the imperative if this investigation was finished and then the police investigation was finished? What would be the imperative to open it up again?
To see if there's any further learning from the additional cases, to add to the themes that have been identified by way of the initial, exercise.
You're accepting that there's significant room for flaw here in terms of the lessons learned or people accountable.
I don't know that I would go as far as using the word flaw, no.
There's certainly an incompleteness.
Yes.
If the committee believe that they want all 22 cases to be reviewed immediately, that is something, Mr McKinney, that we cannot do, and we don't have the powers to do it. And I don't quite know who would have the powers to do it.
Yes, but it's back to the original question. Is the SBNI process the appropriate process in this in the first place? Should it have been chosen because you're now having to amend the rules to get the report through? And whatever about the levels of that, you're having to do that. So was the SBNI approach the right one in the first place? The department was determined to push it through. I remember well the evidence session here or next door. But was it the appropriate vehicle for proper, complete investigation?
Given the powers available to us, I think it probably was the best. By that I mean the SBNI has statutory functions and powers and duties, and we were making use of the powers available to the SBNI.
But it doesn't have powers to call or to demand or insist or coerce, if you like, in that sense, legally, people to come before it and do things, as we heard that claim. So it's flawed.
If that's what was sought, it will always fall short, if that is what was sought.
We will argue over the language, but it's not complete.
Yes.
Or in that view, I would say flawed. And that may cause a flaw in the outcome of its deliberations.
I mean, what I will say is ideally I would have liked all 22 cases to have been reviewed as part of this exercise, and that's where we started.
The further flaw, and it's back to my first point about perception, is that if people think that you've lowered the bar against a flawed process, then the total exercise will have failed in the public mind.
Well, certainly.
At least there's the possibility of that.
Yeah, well, I think, Chairman, again, one of the reasons why I was keen that actually at my previous appearance before the committee to raise this issue was that very issue of perception. Because I think it's really important that at the end of the day, the committee actually do understand what we can do, what our powers are able to do, and what we're committed to doing, and how we're committed to doing. I do believe, others may say it's flawed, I do believe we will bring before you a document that is as comprehensive as it can be in the circumstances, and will endeavour both to learn and to answer the question that was given by the Minister in terms of the direction about how effective services were in protecting these children. I believe we will do that, but we will not be able to do it for all 22 children.
Okay, Chair, thank you very much.
Okay. I have Gordon next.
Thanks, Chair, and thanks very much, folks. Just to clarify, we're a year into this inquiry, is that correct? Are you confident, Eilish and Hugh, are you confident in the level of work that has been done? Have you a clear confidence about what has been done is of good standing?
Well, where we are is that the very first task that I had to do was actually to look with the Public Prosecution Service and the Police Service of Northern Ireland to create a memorandum of understanding about how we would proceed to carry out this review in the context of an ongoing criminal investigation. And
I think that's important to everybody. There is an ongoing criminal investigation here.
Yes,
yeah.
Exactly. And because that was the case, and with the canvas of not compromising, undermining or interfering with that criminal investigation, which is a pretty broad canvas, then basically what we had to do was to work closely with the Public Prosecution Service and the Police Service of Northern Ireland to try and agree a memorandum of understanding about how we would act and deal with that. Now that took some time. A second issue then which we really had was the whole question of actually working to create a group of people who would support this piece of work. And I think it's section 16 and let's just report, she set out the various arrangements we've put in place. One of the things I'm really confident about, and I want to say to you, is that you will see that we established again, section 16, you will see the pages aren't numbered, but the 1, 2, 3, 4, 5th bullet point, a quality assurance team. You will see that we've actually established a quality assurance team, and I explained to you who are the individuals on that quality assurance team. I was very, very keen, and I can say this publicly and with confidence, I was very keen that the people who we would bring forward would be expert and experienced, but as keen, equally as keen, that what they would do would actually commit themselves in terms of their professional reputation and their integrity. That the process that we are putting in place is fair, comprehensive. I met with those people as recently as last Wednesday. We meet them periodically in terms of this particular review. This was an issue, again, we discussed about. I was saying to them very, very clearly that it was absolutely crucial that they were prepared to say that they believed that they believed this process was fair, reasonable, proportionate, done properly, and that there was nothing held back. And that was the challenge and the task for them. I believe those folks will actually give you a full and honest appraisal, and I believe that appraisal will be along the lines I've described.
Okay, Eilish, are you satisfied with the work that's been done to date?
I've already said it today, I certainly have confidence in the process of review established by the chair of the SBNI, and we have the quality assurance team that Hugh has referred to as only one part of that process. There are a number of other different measures put in place to ensure that this review is sufficiently independent and is seen to be independent. So the answer to your question is absolutely yes.
Okay. In relation to the putting in the deputies, how would you see that process moving forward?
It requires us to amend the regulations.
Yeah.
The regulations currently set out who the members of the SBNI are, and it includes designations like the Director of Social Care at the Health and Social Care Board. The proposal, by way of the preferred option, is to amend Regulation 3 to, alongside the named person in that regulation, also name a deputy. That deputy may attend meetings of the SBNI in place of the originally named person. I mean, it is a matter of fact that the people who are members of the board cannot attend all of the time. They are very senior people within their organisations, have competing priorities all of the time, and sometimes the SBNI and attendance at SBNI meetings is not the priority at a particular point in time. So on reflection, even though we didn't want to do it originally, probably there is now a necessity, and that's been borne out in practice, to introduce a system of deputising, and that's how we intend to do it.
So the deputies would be people, competent, professional people that would be put in place?
We've asked for deputies to be named on the assumption that Regulation 3 could be amended. And I can assure members that the deputies who have been named by respective member organisations are very senior people within the organisation. So in place of a director, you will have an assistant director with direct responsibility for safeguarding, for example.
So the people that are committed to the task?
Absolutely, committed to the task. In terms of the police, you will get the head of public protection within PSNI in place of an assistant chief constable. And Hugh, for the district councils and education and library boards, you will simply be swapping out one chief executive for another chief executive. So in that sense, deputisation is actually at the same level within the same body.
Can I just add one thing to that, Mr Dunn? The view of the Safeguarding Board when it discussed this matter was that deputisation would be a boon, but it needed to be carefully controlled. Carefully controlled, but in two ways. Firstly, by naming people who were senior and dedicated, so it wouldn't be a situation where you deputise one meeting and someone else deputises another meeting. And secondly, that the chair of the Safeguarding Board should be able to ensure, through discussion, that the senior staff themselves continue to attend and it doesn't become de facto a downgrading. This was the board's own comments. It's not the chair's comments, not the department's comments. It was actually what they were suggesting. But these are very, very senior staff, and other events happen, and they are just called away.
Okay, thanks very much. Thanks, Chair.
Thank you, Gordon, and thank you both for that. I suppose, I mean, just by way of concluding remarks, the committee will return to this in the next number of weeks. I suppose the point that I would make is in terms of deputation, whether a person is named or not, it's very apparent that the issues will remain the same. And I think that that's the big challenge for us, whether the person's senior, junior or at whatever level, and I have no doubt too that the professional approach that all of your members take to the work that they have to carry out, and I think that goes without saying, and I think we're all mindful of the very vital work that goes on there. However, I think there are still issues that I would hold that that I'm not convinced that what I've heard today would be the effective model in going forward, and I'm certainly not convinced that by reducing the quorum by your own admissions here today would remove those obstacles. Those obstacles will remain in terms of the data protection, the 3 or 4 issues that have been highlighted here. They will remain, and I think that that it's vital that we get this right. So I'm not convinced as we go forward that this is the appropriate vehicle, and what I've heard today hasn't reassured me of that. So I thank you for your time, and we will return to this. Thank you. Okay, members, in moving forward, and as I have outlined, we will return to this. We will return to this next week. In terms of the proposal from the department, there has been an indication that they would submit a formal SL1 in due course. The purpose of that would be to request the committee's approval to make the regulations in effect the hybrid approach to the quorum that has been suggested there in terms of supported by deputisation. At that stage, obviously, as a committee, we would have to take a decision as to whether we were content to proceed. So, as I said, I think we need to return to this. I think clearly there are 2 issues here. A, as to whether the vehicle is the effective and appropriate vehicle to continue with the thematic review. I have stated my view on that. And that leads on to a yes or no answer as to whether we would consider the reduction of a quorum as to be the appropriate approach. So we need to come back to this, members, and I'm seeking your approval to do that with a degree of urgency and to have that on the agenda next week.
Chair, just on the Safeguarding Board itself, did we as a committee approve the Safeguarding Board a couple of years ago?
I'm going to look to the clerk of the committee because it was before my time.
Well, the committee took the committee stage of the safeguarding bill, and the bill was eventually approved by the Assembly, became an act, and the safeguarding board was set up.
So some years ago, I suppose, really?
It was the last mandate.
Was it?
I was on the committee, and yeah.
And I think what we need to be mindful of here, members, as well, is this isn't a reflection on the Safeguarding Board.
Oh.
The Safeguarding Board, and I've outlined now on 3 occasions, do vital and valuable work and will continue to do that and should be supported to do that. The issue for ourselves today is whether that is the appropriate vehicle for a thematic review, given the very clear challenges that it has come up against. And given, in my view, those challenges should have been foreseen.
They were foreseen, Chair, and they were addressed at the meeting December 2013 when this was set up. These issues were raised, and changing the process now midstream. And I'm conscious that I've heard there, we've gone so far down the road. That's not good enough for me for changing the rules of what you've articulated as being, you know, a board which is doing otherwise good work.
Absolutely. Okay, members, we will be returning to this. Okay. Moving on to item 7, which is the review of the departmental approach to the budget 2015. Refer members to page 181 of the meeting folder. Just advising members, obviously, that this is a key piece of work for the committee going forward, identified as one of our work priorities. We have an Assembly researcher, Colin, here with us today to brief members on the budget position and the level of resources allocated to health over the last 5 years. Colin, yes. Just want to advise members that ministers and officials have been invited to give evidence to the committee on the review at our meeting next week. So today's briefing is important, I suppose, in terms of preparation, Colin, for that. So you're very welcome, and I'm going to hand over to yourself.
Thank you, Chair. Hopefully I can lighten the mood after that session. I'm not sure I'm going to be able to, but I'll try. Okay, this paper is essentially, as you've outlined, Chair, to provide a sort of background briefing in advance of the committee moving forward and looking at what the budget position is going to be for the department next year. So what I have tried to do is be very comprehensive in terms of presenting what are the rules around budgeting that are important in the context of the current difficulties in this year. I've set out the outlook for next year in terms of what we know at the moment about what the expenditure, what they call the funding envelope, will be. Briefly mentioned the budget process that needs to be entrained for next year, and then looked back really at the pattern of resource allocation to health over the preceding years, just to really see what has gone before in order to understand where we are now. So I'll move through each bit in turn. In terms of the budgeting rules, I mean, first and foremost, I shouldn't, and I probably don't need to tell this committee, I'm sure you're all fully aware that the current budget runs out on the 31st of March next year. And the Northern Ireland Act requires the Executive to lay a draft, or rather the Minister of Finance to lay a draft budget before the Assembly before the end of the year. And then the Good Friday or Belfast Agreement then sets out that before that happens, the draft budget should have been scrutinised by Assembly committees. So it's giving this committee that role and the other committees that role in the process. Now, in terms of the other elements of the budgeting rules, there are these non-statutory policies, but they make it very clear that the budgets are spending ceilings, that they're not indicative amounts, but they are maximums within which both the executive as a whole must live, and then the departments also have to live within. And the consequence, obviously, of not living within those limits at a departmental level is then that the executive has had to take this measure, which the Finance Minister was speaking to on Monday, in terms of gaining access to the UK Reserve for additional funds for this year. I say there are a number of policies which make this kind of same point. The overarching one would be the Treasury Statement of Funding Policy, which emphasises that budget pressures should be contained within the executive. The Treasury's Consolidated Budgeting Guidance makes the same point, and there are DFP policies as well, which also reinforce that point, saying that departments must treat allocations as ceilings and not as purely as indicative or any other. View them in any other way. So I'll not labour that anymore. The second section of the paper then looks at the resources that are available for 15-16. Table 1 on page 6 just shows the sort of total amount that DFP provided to us in research towards the end of August. So that was the latest position at that time. Now, as a consequence of the Minister's statement on Monday, we have to bear in mind that should the Executive use the full 100 million access to the Treasury Reserve or the UK Reserve, then that total will be reduced by £100 million for the next year. So that is already, I suppose, unfortunately, is already out of date potentially. Going beyond that, looking beyond next year, the only thing that I was able to find that really referred to it was a speech that the Minister of Finance had made, which just refers to, and this is on page 7, I've cited it on page 7, to resource expenditure likely to go down by another 5%, 5% and 3% in the years following next year. So from that we can take that the position is unlikely to get any better, and realistically it's going to get much more difficult. In terms of the budget process for next year, now there have been, I think, some developments as of the Minister's statement on Monday in terms of the access to the Treasury Reserve has led to the Chancellor of the Exchequer saying that there is a sort of condition on access to the reserve that the Executive has agreed a budget, a draft budget, by the end of this month. So they don't have very long, basically, in order to make this agreement. But already the timetable is far beyond what the ideal situation would have been. You know, by this point, according to the sort of the process that the Department of Finance had initially set out, there would already have been by now Assembly engagement on the draft budget, and you know the public consultation would be coming then subsequent to that. Now it looks like the time for that is obviously going to be compressed, so it is going to be an issue for this committee in terms of how it actually is able physically in the timetable to contribute to that budgeting process. But I suppose the imperative placed upon the Executive by the Chancellor is trying to kickstart the process and speed it up, if you like. So the final part of the paper then is just to look back at the budget allocations up to now. And the main reason for doing this is to, first of all, to highlight that despite some of the language that's been used in the press and elsewhere, the Health Department's budget has not been cut to this point. It has possibly not grown as quickly as people would have liked to have done, but the point remains that it has not been cut. It has continued to grow. And the way that the Executive ring-fenced health and other departments, certain other departments in June, pushed the level of savings required and loaded them onto other departments. And a similar approach has been taken then in the October monitoring. Again, we saw on Monday that certainly the resource element of the health budget was protected again. And indeed, there was an allocation of 60 million to help try and alleviate some of the current pressures. So I'd just like to draw attention, just to highlight this point really, to Table 3 on page 11, which just shows for non-ring-fenced resource DEL, so that's the area where the Health Department has been saying it's got the real problem at the moment rather than on the capital side, that from the starting point for each of the financial years going from 2010 up to the current year, there's been an 8.8% increase in the allocations made to health. Now that's cash terms, not real terms. So obviously inflation has eroded the buying power of that money, but it is the cash budget that the department has to manage. So that's I would say, the best way to look at it. And then if you look then at Table 4 and Figure 1, I worked out the proportion of the total budget that health receives, and you can see that it has been increasing over the years up to this current year. Health is getting 44% of the total executive budget, which is up a couple of percentage points on what it was in 10-11. Now, And that's really just shown in the figure as well below, and you can see that the trend has obviously been upwards. The total allocation to health as a proportion of the whole has been increasing. Now, the point obviously seems to be that is still insufficient, but the question, I suppose, the key question for this committee, looking at next year, is how realistic is it for this trend to keep continuing indefinitely, that health will continue to absorb an increasing proportion of the overall executive's resources, and that discussion needs to happen. Is that what the executive and the people of Northern Ireland want to happen? Because there is a sort of skewing of public resources towards health away from other places. With that in mind, I sort of finished off with a point, really, just to say that obviously the health department must be planning at this moment for a range of scenarios around what they think they will get, and I'm sure the committee has asked the department to provide briefing on that. But it's the question of, even if you assume that current trend of increasing allocations continues, then it may not be enough for what the department would like to deliver. So there are obviously going to be issues going forward. On that bright note, I'm afraid I'll try and take any questions you have on what I've presented to you here.
Okay, thanks, Colin. Thank you. And I mean, it's useful, very useful piece of work. But I suppose what I'm interested in as well is that we talked about was it 44% of the total budget, total executive budget?
Yeah.
And whilst you can note that there's, if you like, a cash increase in cash terms in health, what I'm gathering from this, it doesn't necessarily follow that that's based on need or identified need within health and social care. Would that be?
No, that's right. I mean, there is a discrepancy between. There's obviously a discrepancy between what the Department of Health and what the Minister is saying the Health Department needs in order to stand still. I think that's the word that they've used in briefing this committee, and what they have. So, yeah. So in some ways, those figures are of interest, but they don't resolve any problems. The fact is that yes, the allocations proportionately have continued to increase. That's a fact. But it also is the case that the Minister has been saying that it's still insufficient. But so looking forward, I suppose the question is how much of the whole Northern Ireland executive resources is health going to need in order to meet its requirements, and how much realistically will it be able to obtain? That's the.
Yeah, and I mean, I noted that the Finance Minister made reference to those, the need for those creative solutions, the need for those difficult conversations around, particularly around health spend, and just in the course of the last few days. But one of the things as well that's apparent is the almost reliance, if you like, on monitoring rounds.
Yeah. Yeah, and I think that's partly the reason why I sort of laboured, and the front end of the paper laboured this point that these allocations must be treated as ceilings, that the department can't rely on monitoring rounds, and not any more than any other department can, and particularly as other departments are also finding that they have expenditure pressures. How likely is it that there will be any money in the monitoring rounds in order to distribute? That's the sort of overall picture, is that you won't. Not only should you not be relying on monitoring rounds, but the reality will be, even if you do have to use the monitoring rounds, there may well not be much in the pot to distribute, particularly when you take the additional 100 million into this year from next year.
And I mean, finally, for me, was just the issue about, and I suppose it's more associated with monitoring rounds, but is important in the overall budgetary context is the link with priorities. And I mean, it was one of the issues that was very clear in the financial training that the committee participated in recently, around the lack of correlation sometimes between the department spend, the programme for government priorities and outcomes.
Yeah, what we found when we looked at that, as you'll remember from the training, is the paper that we produced in order to support that, was that it wasn't always clear what the link was, and in fact it didn't necessarily carry through from a priority being identified as particularly high, with it necessarily getting an allocation, or it not being identified as a particular priority and it's still receiving an allocation, if you see what I mean. So yeah, the linkage wasn't clear from the documents we looked at. And I suppose the point, Chair, that you're making is that it becomes increasingly important to ensure that resources are targeted towards the highest priority areas.
Okay, thank you. Fergal had indicated.
Yeah, just a small point, and it is just extending from the point that you're making about the monitoring. The money's not going to be there. Not just health, but every department will be tempted to bid more at this point, knowing that they won't get money at that point, potentially. I'm not asking you to make a judgment on making more.
Well, the pressures will exist, and I'm sure that the departments now, as they're looking to next year, will be thinking, right, okay, we have to ensure that we can at least meet our barest requirements or whatever.
No, what I'm suggesting is that potentially departments will overbid to ensure that they don't find themselves going back to the pot that will be dry next year. You know, it's a dynamic that you can imagine. I mean, for example, in the ETI committee recently, they were telling us that they bid into the October monitoring round for events that are in the calendar, and that they'd already contractual agreements arranged, legal agreements on, and that they were then settling the bills on. You know, so there won't be any of that, because there was an understanding that money would be available. I think there just needs to be a consideration of, if there is no money available, potentially in a monitoring round, what impact does that have on the original bid? It's just a question, really, not to be answered here, but just...
Yeah. Okay, unless members have any... Gordon,
yeah. Table 2 there, page 194. I think that's the total budget then for each department. We are on what, 4.5 billion?
Yeah.
Yeah. And there was no reduction in the June monitoring round.
That's right.
Yeah. But the issue is really our budget has continued to increase, as you've mentioned, but demand outstrips that, really.
Yeah. And it's... yeah, and I think that's something that is in the committee's terms of reference, Chair, for the inquiries. What can be done in terms of, you know, looking to other jurisdictions about how they've enabled, you know, to live within or to manage demand, and that's certainly something, you know, that obviously demographics is something that you can't control just like that. So there will be a number of factors which will be difficult to control, obviously. So yes, you're right.
Okay, it's a huge part of the budget, 44%. What's the actual budget, isn't it, roughly?
Yeah. And I did, just for the sake of interest, I got the spreadsheet to project forward, you know, if you carried on that trend, how long it would be before health actually consumed more of it. And I think it was by it says it somewhere in the paper, by sort of 2025, you would find, you know, on that pattern, you would find that health would be using half of the budget. And of course, eventually, if you continued along the same route, it would be taking all of it. But yeah, that would be a long way down the line, I'm sure.
Okay, thank you. On that positive note, we'll end.
Thank you. Okay, Colin, thank you for that. That's useful and going forward in terms of our deliberations around the budget, so thank you for that. Members, item 8 is an SL1, is the misuse of drugs Amendment number 3, regulations. It's on page 199 of the meeting folder. I just want to inform members that the reference to CAT, as it is, K-H-A-T, has been banned under the Misuse of Drugs Act 1971 to address the risk of the UK being used as a hub to smuggle CAT. It has become a controlled Class C drug on the 24th of June 2014. Advising members that the Department is proposing to make a statutory rule to add CAT to the list of drugs which have no medical or legitimate use outside research purposes. So that will bring the North in line with measures introduced for England, Scotland and Wales. So are members content that the Department makes a statutory rule?
Agreed.
Thank you. Item 9 is an SL1 on the misuse of drugs, amendment number 3 order. It's on page 205 of your meeting pack. Advising members that this rule relates to the previous one and will designate CAT as a drug to which section 7.4 of the Misuse of Drugs Act 1971 applies, and to be placed in Schedule 1 of the Misuse of Drugs Order 2001. Again, this will simply bring the North into line with measures introduced for England, Scotland and Wales.
Is that Northern Ireland? Yes.
Are members content that the Department makes a statutory rule?
Eastern part.
Yes. Great.
Thank you. Item 10 is again another SL1, the Health and Social Care Disciplinary Procedures Regulations. It's on page 211 of the meeting folder. Advising members that the Department is proposing to make a statutory rule to revise the procedures for disciplinary hearings for a chemist, dentist, medical practitioner or optician failing to comply with their terms of service. The Department consulted relevant professional bodies and has made some amendments to reflect their responses. A second consultation on the amended regulations was carried out again with the same bodies, the results of which indicated continued support for the introduction of revised regulations. So are members content that the Department makes a statutory rule? Item 11, members, is the Forward Work Programme. Informing members that there's a revised Forward Work Programme for the period October to December at page 216 of the meeting folder. Advising members that following discussions at the last planning meeting, arrangements have now been made for a session on effective questioning to be delivered to members on Wednesday the 12th of November 2014. There will be no committee meeting that day. So the training will be delivered over 2 sessions. The first session will run from 2 p.m. until 4:45 in room 29. The second session will take place over dinner in room 115 from 5 p.m. until 6:30. So I'm informing members also that we had looked at, rather than simply just effective questioning, but looking at this in relation to the mental capacity bill coming forward. So it will be of particular relevance, obviously, to this committee and in terms of going forward. Members, agreed?
Right.
Item 12 is matters arising. There are 12 items under matters arising, so I'm just going to draw members' attention to several of them. The committee had asked for clarification on how the Committee for Justice had dealt with correspondence from the Commissioner for Children and Young People and the Law Centre, asking it to consider tabling an amendment to extend the scope of Clause 12 of the Human Trafficking Bill. Advising members that at its meeting on the 24th, the Committee for Justice noted that it completed its consideration of the bill and additional amendments, but highlighted that individual members may and can consider the merits of proposed amendment. So I'm reminding members that this was the same approach taken by this committee and that individual members can consider tabling proposed amendments if they so wished. Okay, for information. Item 12.2 on 221 is a summary of the discussions and proposed actions from the informal committee stakeholder event, which took place in the Long Gallery last week. I think members who were in attendance, I think it was very useful engagement, really good participation. I think there was a total of 18 organisations from different sectors that attended, and I just want to maybe take the opportunity to thank all the staff who worked on this and indeed produced the report. There's a number of items by way of action in the report that we will be following up on. So I'm asking our members content to note the actions as outlined in the report.
Sure.
Great, yep. Thank you.
Just in the minimum unit pricing
Yep.
legislation, I think you have suggested there that we sponsor an event in the Long Gallery or something, and that would be very positive.
Absolutely, yes. I think we
Very
should,
supportive of it.
as a committee, take that up.
Good.
Can we agree that then, that the committee will sponsor
Agreed.
an event?
Agreed. Close the pubs. Agreed.
Don't drink at that one, Gordon, eh?
Here.
Just in terms of protocol, I know the clerks just keep me right. The request would need to come from the group, but it did actually. They had suggested that, but we can go back and just formalise that with them.
Will you do that?
We can do that. Yes.
Thank you.
Okay. Item 12.5 on page 230 is the response from the Minister on the committee's query as to whether the shift in funding for 2014-15 in line with TYC is still regarded as achievable. The Minister indicated that he was not in a position to answer the query until the issue of funding for 14-15 has been resolved. I'm seeking agreement to write to the Department for an update now that we know the outcome of the October monitoring round. Agreed?
Great.
Great. Item 12.6 on 231 is a response from the Minister regarding the timing of the introduction of the Mental Capacity Bill. The Minister has indicated that it has his intention to introduce the bill as early as possible in 2015. I'm seeking agreement that we write to the Department for a better indication of when in 2015 the bill will be introduced. Agreed. Thank you. 234 is a response from the Minister regarding the recommendations contained in the Age NI report, the denial of NHS continuing healthcare. Seeking agreement to forward the response to Age NI for information.
Great.
And seeking agreement to note the remaining correspondence unless members have any comments they wish to make. Item 13 is correspondence. There are 18 items of correspondence in the meetings folder. Again, in the interest of time, I just want to draw attention to several of them. Page 240 is correspondence from the Minister advising of a consultation on firefighters' pension scheme regulations. I am seeking agreement to request a written briefing summarising the outcome of the consultation, which ends on the 30th of November. Agreed?
Great.
285 is correspondence from Armore Care, inviting the committee to visit its new service, Apple Muse in Armagh, which provides accommodation for adults with complex learning disabilities. Obviously an important, vital piece of work, but I'm suggesting the committee writes back to thank for the invitation, but due again to the committee's workload at this stage, will not be able to schedule a visit at present, but we certainly would consider that again in 2015 if members are in agreement to do that.
Great.
Okay. Page 286 is correspondence from the Pharmaceutical Society requesting to brief members on its work. Are members content to invite the organisation to the next informal stakeholders event?
Great, yeah.
Page 288 is correspondence from a Mrs Lee regarding dental work, suggesting agreement to write back to Mrs Lee advising that she contact her local MLAs in relation to the matter. And 289 is correspondence from a Mr O'Hare regarding Ebola, seeking agreement to forward the correspondence to the department and ask that it responds directly to Mr O'Hare. And seeking agreement to note the remaining correspondence unless members have any comments.
Great.
Item 14 is any other business. Do members have any other business? And item 15 is date, time and place of next meeting, which will be on Wednesday, the 22nd of October at 2 p.m. in room 29.